Let's not. Well, good morning, everyone. I am Karen Cito. I'm a professor here at the Yale School of the Environment, and I am also the faculty director of the Yale Hixon Center for Urban Ecology. And I'm delighted to welcome all of you here live, as well as those of you who are joining remotely from wherever you are in the comfort of your home, hopefully. Today's conference topic is COVID's impact and the future of cities. This is a very big topic, and we have a very exciting group of Yale faculty to share their thoughts on COVID and the future of cities. So today, as we start this conference, we have worldwide 250 million cases of COVID and 5 million deaths. So as we are approaching the second year anniversary of the COVID-19 pandemic, there have been a number of questions about what will happen to cities. Are people all going to flee the city for the suburbs? But at the same time, we know that cities are the engines of the global economy as well as national economies. By some estimates, cities generate somewhere on the order of 85% of the global economy. And we know that the majority of the human population globally lives in cities and towns. So what will be the future of cities? And will the pandemic shut down cities? Prior to the pandemic, every week we had about 1.3 million people worldwide moving into cities. Will that slow down the investment in real estate of cities? And how can we make cities healthier and safer going into the future? So today's day-long event will feature 3 panels that will explore the relationship between urban living conditions and viral spread, the impact of shifting concentrations of people and capital on real estate investments, and also the causes and effects of increased utilization of urban natural space. I want to just quickly note that this is a hybrid event, and we will take questions both virtually and also in person after each panel and speaker. So I'm going to just get started and introduce our keynote speaker today. Professor Frank Snowden is the Andrew Downey Orrick Professor Emeritus of History and History of Medicine. Professor Snowden tried to retire a few years ago. He received his PhD from Oxford University. He taught at London University from 1978 to 1991, and he has been at Yale since 1991. He chaired the program in the history of science and medicine from 2008 to 2011. And his research interests include the comparative history of epidemic diseases, the history of public health, the impact of emerging and resurgent diseases, issues in medical ethics, and bioterrorism. Professor Snowden has been long fascinated with the ways in which epidemics reflect social, cultural, and political conditions in the societies in which these epidemics arise. At Yale, Professor Snowden pioneered the study of epidemic disease in modern Italy. He has written a number of books. I'm just going to highlight one. Cholera, Conquest of Malaria, Italy, 1900 to 1962. This book was awarded numerous prizes, including the Gustav Reines Prize from the Macmillan Center at Yale for being the, quote, best book on an international topic. It was also awarded the 2008 Welch Medal from the American Association for the History of Medicine. And of course, his most recent book, Epidemics and Society, From the Black Death to the Present, published by Yale Press, was published in 2019, right before the pandemic. So before we started, I said to Professor Snowden that he was incredibly prescient in publishing this book right before the pandemic. And of course, it's a challenge to get it now because it's been selling like hotcakes. So without further ado, let me welcome Professor Snowden to give his keynote. Thank you.
Thank you. Thank you for your very generous introduction, and it's a great pleasure and an honor to be with you this morning. What I would like to do is to begin with a reflection on what I think is a great hazard, which is not to learn something from this pandemic. And we can see that, I think, two unhappy moments were when July 4th was proclaimed last summer as Independence Day, not only a national holiday, but also independence from COVID-19. And not to be outdone, Great Britain proclaimed Freedom Day when the population of the UK would be free of COVID-19. Now, this seems to me a very unfortunate development, and I believe that the COVID-19 is very likely to be with us for a long time. And so the great challenge is, what are we as a world population going to do about the threat of pandemic diseases that are not becoming less likely? But this seems to me that this can be considered even a dress rehearsal for something possibly even worse that could happen in our future. So what are we going to do about that? And it seems to me that one of the keys, now there isn't a single solution to the problem of pandemic disease, and I'm not going to try to present one this morning. We need scientific tools like the vaccine. We need preparedness, research. We need a World Health Organization that is actually funded and well supported throughout the world. We need our science. We need lots of different, we need control over such issues as globalization, which is totally unregulated. Or are we going to make it accountable for human needs? Our health system. So one could go on, but one of the features is cities, because cities have been at the center of many of the perplexing crises that we're facing today. Public health, as COVID is making us painfully aware, is absolutely one of them, but also problems of social disparities. Environmental problems are also enormously reflected in the use patterns of urban space. So I think that one of the challenges, well, someone asked me if I was an optimist or a pessimist on the basis of what I do for a living, and or used to do for a living. And I think I answered that there's good news and bad news. That the good news is that microbes have no agency. They reach us through conduits that we have created. And so the good news is that the future is up to us. But I'm afraid the bad news is also that the future is up to us. So I think we need to reflect on that. So what I'd like to do this morning is to talk about two contrasting examples from the past. One will be the Spanish influenza, when I will be arguing that not much was learned. And the other is Asiatic cholera, which led to profound transformations. I'm thinking of urban life and cities. And the question then, at the end, I'm going to violate my oath of office by sort of writing the history of the future and thinking about what might happen with COVID-19. So that's where I'm going. And the first thing I'll do then is to talk just for a few minutes about the Spanish influenza and what happened then. Now, the Spanish influenza is interesting partly because it's one of the greatest catastrophes ever to strike mankind. It something like it was on every continent except Antarctica. It struck something like 40% of the world's population, from the Inuit population near the Arctic Circle to Fiji and Samoa, and every place and community in between. It killed, by various estimates, from 50 to 100 million people worldwide in 3 waves in the summer and fall, particularly the fall of 1918 into the spring of 1919, and with a few localized surges in 1920. So this was an enormous catastrophe, and yet, what happened? And it was, above all, of course, it began in urban areas. Boston, Chicago, London, Berlin were the great centers of mortality because of density of population, of course, and a pulmonary disease. It was a pulmonary disease, and in that sense spread through the air by droplets and aerosols in ways that were now very familiar. And so the epidemiology of how this disease was transmitted and spread is rather familiar to us from our own recent experience, and cities were a decisive place in the spread of the Spanish influenza. And yet, what happens after such an extraordinary international catastrophe? It was largely forgotten. If you look at monuments to the First World War, which was contemporary, there are monuments everywhere to the commemorating the First World War. The UK is full of them. Monuments to the heroes of the Spanish influenza, however, are simply non-existent. In the UK, there is exactly one monument, to my knowledge, to the nurses, physicians, and frontline workers who gave their lives in this pandemic. It's a stained glass window in the East End, a church in the East End of London. And to my knowledge, that's the only monument in the whole of the United Kingdom remembering this. One of the great books about the Spanish influenza is subtitled America's Forgotten Pandemic. If you look at the arts, of course, there is the famous paintings, 2 paintings by Edgar Munch about himself as self-portraits as a convalescent. And of course, we have Catherine Ann Porter's wonderful biographical reflection, autobiographical reflection, Pale Horse, Pale Rider, but the record is nothing like that of, you think of the plague, and there's a whole plague literature, a whole tuberculosis literature. There simply isn't a large literature of the Spanish influenza. Historians also neglected the Spanish flu until the centennial, and then in 2018, suddenly there's been this enormous upsurge of interest and publications and working out its transmission and all the rest. But it took 100 years for that to happen, and we were warned by the Surgeon General, Rupert Blue, that he was unable, he actually said that he couldn't really protect the health of Americans. The reason was that there was no legal authority for a centralized, coordinated, unified response. I imagine that sounds very familiar, and he recommended that there be a constitutional amendment that allowed the federal government to take the central role in public health emergencies. And this was a recommendation of 1918. Now, why was there so little done? Well, there are many reasons, one of which, of course, was that the world was preoccupied with other crises. The chronology is clear. The First World War was in everyone's minds. And so that took precedence. And quickly, as part of that, we also see the Bolshevik Revolution. And then the coming of the peace conference after the war and the division of spoils and all the rest of it. All of those issues took precedence. There was also something that was worrying, which has to do with the muzzling of the press and the government. And that is to say that throughout the West, there was an imposition of censorship so that good news, there was even a Sedition Act in 1918, which made it possibly punishable by imprisonment for writing or publishing material that would depress the morale of the public. And so what you see in the press at the time is a constant sugarcoating of the truth that, oh, we've reached the peak, things are getting better. It was from the beginning of the disease to the end, everything was always getting better. And there was always light at the end of the tunnel. Maybe this may sound a little bit familiar also from things that we've heard in recent times. So it was also the case that the Spanish influenza moved really rapidly through populations. So it didn't lay siege to them in the way that, say, cholera and the bubonic plague did, but in the human body, it was a rapidly progressing disease, and in communities it lasted. The mortality was huge in communities, but not in an individual place. Everyone got sick, but the vast number of people recovered, and so it was easier to put in the back rearview mirror a disease of that kind. So there were lots of factors that led to this forgetfulness. And since I've got just a little bit of time, I'm going to stop there with the Spanish influenza, and I'm going to move on to the Spanish influenza is my negative example. Pandemic diseases, there's no law about pandemic diseases. I hope this is right because it's what I teach. That pandemic diseases, each one needs to be studied on its own and is individual in its effect, its impact, its legacy. There is no single pattern like cookie cutters for how pandemics are going to unfold. So a very contrasting example to make that point is Asiatic cholera, and this brings us to what I think Asiatic cholera is not hopeful. I don't want to be saying that. What I'm saying is the response to it in terms of cities actually was and saved and continues to save millions and millions of lives. What happened, Asiatic cholera swept through Europe in a number of waves, pandemic waves, 5 in the 19th century. I hope that's the right count. I think 5. Let's go for that this morning. They generated enormous collapse, social disruption. Symptoms were agonizing, dehumanizing, excruciatingly painful. And cholera was a disease. It was hard to forget because people felt sick and could die in public, writhing in agony. They had been helpful. You could be healthy in the morning, get on a train, and die before you reached your destination. And you looked unrecognizable to your best friends just a few hours after the onset in the most severe cases. So this was a disease that was not forgettable, and it was therefore a disease that there was considerable desire to take drastic and responsible action to prevent its return. And so we have in 1840, oh dear, again, let's hope I'm right, 1842, it's about then, Edwin Chadwick wrote an enormous monumental study called Report on the Sanitary Conditions of the Laboring Populations of Great Britain. And this was built on the filth theory of disease. So it's a medical theory. This is one of the interests of it. A medical theory that's no longer accepted led to enormous progress in public health, because the consequence of Chadwick was an administrator and not a physician but a lawyer, and his work, supported by Parliament, was the great sanitary movement. And the sanitary movement led to its program was using William Harvey's idea of blood and its circulation, was to think of the city as a circulatory system. And so what you would do is the arteries would bring in clean water throughout the city, and there would be pipes to homes, and then the waste would be disposed through the veins, through sewers and drains. And so every city in Britain was retrofitted. Imagine this is a public works program to every city in Britain, and this happens from the period from about 1850 to about 1900. So it takes half a century to be completed, but it's a vast, vast project, and with it go street paving, street sweeping, and the inculcation of new sanitary habits. So this did prevent the return of Asiatic cholera. It also prevented gastroenteritis, typhoid, a whole series of other diseases, and was one of the great causes for the decline of mortality in the late 19th century. This was a major, major reworking of the urban centers, and the model spread across Europe. It spread to North America, and two cities actually were completely rebuilt. One was Paris under Napoleon III, partly for reasons of prestige and empire, but also there was this idea of bringing in light and air. And so the broad boulevards we see in Paris today are the work of a public health program. And Naples, also one of Europe's largest cities, was completely rebuilt with the single purpose of preventing the return of cholera, again with this different theory that is no longer medically accepted, but it was nonetheless a health program that had enormous consequences. So my question here today is, what are we going to do? Are we going to follow the example of the Spanish influenza, or are we going to follow the work of people who dealt with Asiatic cholera? And one of the forefronts in this debate of what we're going to do, of course, is the city. Now, this is a little bit not as, in the first, I would have been much even more emphatic during the first wave of the pandemic, because cities were absolutely one after another, from Wuhan to Milan to New York City, Houston, and then Mumbai, Delhi. These were urban areas that were devastated by the pandemic, not surprisingly for a disease spread in this particular manner. But with the coming of the Delta variant, the disease is so transmissible that it's also a disease that is now more prevalent in, say, the United States, in rural counties than it is in major cities. But if we look at the mortality and morbidity across the world, cities are still absolutely decisive, and dealing with cities is something that is tremendously important for the future of our species. So with that thought, I'm going to violate my oath of office and talk for just 2 or 3 minutes that I have left about the history of the future. And it seems to me that I want to take an example, instead of inventing my own idea of what a city should look like, which I think wouldn't be really very interesting or useful. I want to take something that's actually happening and talk to you just for 2 minutes, because that's what I have left, about that. And this is the 30-minute city. And the 30-minute city was began with the pandemic, COVID. This is an idea that has grown out of the pandemic, and 40 cities around the world, including Los Angeles, Portland, Oregon, Paris, Barcelona, Buenos Aires, Seoul, have all come together and decided that the way of the future, the way to deal with infectious disease and with the various morbidities that come from a toxic environment, is to win back cities from the automobile, and also to provide to confront the problem of social disparities, of access to medicine, of access to green spaces, getting rid of the food deserts that we see in so many places, and having affordable housing for all. Now, the place where this has gone, was the great theorist of this, was Carlos Moreno of Buenos Aires, but we now see it being implemented partially in lots of cities. Reimagining cities is going on all over the world. Milan is thinking of how do we reimagine cities where people can move about without being on mass transit and without being able to give social distancing and having recreational activities that can take place in open spaces and larger spaces. So Milan is an example, but Paris is the example where this is going furthest under the administration of the mayor of Paris at the moment, Anne Hidalgo. And this, she is transforming Paris into, from a car-centered to a bicycle-centered place in which to live. And as I'm running out, I'll just say that this also includes urban spaces for recreation. You should be able to do everything to lead a human life within 30 minutes walk of your home. You should find healthcare, education, your living space, recreation space, outdoors, green space, and all the rest within a 30-minute. That would be transformative in terms of urban living space, and it would be transformative in terms of the return of a pulmonary virus like the Spanish flu or like COVID, I almost forgot COVID-19. So with that thought, I've run out of time, and so I'll stop there, and that would be my hopeful scenario for the history of the future. So thank you very much.
Thank you, Professor Snowden, for ending on a positive note and to remind us that we can actually make cities safer coming out of this and that we've done it before. So I'm pleased to introduce the next panel, and I will introduce Professor David Vlahoff, who is a professor at the Yale School of Nursing with a joint appointment in epidemiology and public health. He is also the co-director of the National Program Office for the Robert Wood Johnson Foundation's Culture of Health Evidence for Action program. Professor Vlahoff is an epidemiologist and a professor emeritus, also at the UC San Francisco School of Nursing, where he was previously dean from April 2011 to August 2016. Professor Vlahoff is one of the world's experts on advancing health in urban settings. He is known for research on the social determinants of health. And in 2011, he was elected to the National Academy of Medicine for his work. So please welcome Professor Vlahoff.
Good morning, and Karen, thank you for creating this panel that could bring together such a great group of people, and look forward to the conversation that we're going to have. So what I want to do to start with, thank you for the introduction, is to tell you who's going to be on this panel And it's really an esteemed group. The first, and I'm going to ask him to come right up, is Albert Coe, a physician who's a professor of epidemiology, microbial diseases, and he recently finished his tour as chairman of epidemiology at the Yale School of Public Health. He has an extensive history of working on infectious diseases in Brazil, which we're going to be tapping into his knowledge and experience on that. But interestingly, honorary, he was the COVID-19 consultant to the Connecticut government in thinking about reopening after COVID. And the governor refers to Dr. Coe as our Dr. Fauci. Quote, he's been at the center of the effort to navigate the weeks ahead and to protect Connecticut's citizens and economy against the effects of the pandemic. So he was there with the CEO of PepsiCo, and the three of them worked out the plan. His research centers on health problems that have emerged as a consequence of rapid urbanization and social inequity, and he coordinates a training program of urban slum health in Brazil with prospective community-based studies on a number of infectious diseases. He's looking for identifying prevention control strategies that can be implemented in slum communities. The next person I want to introduce is Anna Diaz Rue, who is the Dean of the Dornsife School of Public Health at Drexel University. She's also the director of the Drexel Urban Health Collaborative and the PI of a very impressive project, which I hope she's going to talk about, Salubral, which is in Latin America. She's internationally known for her research on the social determinants of population health and the study of how neighborhoods affect health. Her areas of research include social epidemiology, health disparities, environmental health effects, urban health, psychosocial factors, cardiovascular disease, social environment gene interactions, and the use of multi-level methods and complex systems approaches. So we're going to be tapping into a wide range of expertise on this. She is looking to create healthier, more equitable, more sustainable cities worldwide. The next person I'm going to introduce to you is, and I believe he is on the top right on there, is Blessing Maburu, who is a senior scientist, head of urbanization and well-being at the African Population Health Research Center in Nairobi, Kenya. He's a board member of the International Society for Urban Health, and he works on migration, urbanization, adolescent reproductive behavior and poverty in sub-Saharan Africa under the Urbanization Wellbeing Program. He has a PhD in sociology, Master of Arts degree, sociology from Brown, and a master's from University of Abadan. I'm going to go then next to Jason Corburn, who is the director of the Institute of Urban and Regional Development and the Center for Global Healthy Cities. He's a professor of city and regional planning at UC Berkeley and formerly on the board of the International Society for Urban Health. Being that he's at Berkeley, we appreciate you being up at this time to be able to work with us on this panel. He's working to improve the lives of residents in informal citizens, settlements in Nairobi, and he also works in Rio de Janeiro. He has first author on a paper that came out early in 2020 in the Journal of Urban Health on COVID-19 and slum health, and we'll be asking him to say some words about that. Now, before we get launched on our presentations, just something of a note. First, we're going to have some presentations from the presenters here. Each has been asked to give some talks. And then after that, there'll be some question and answer, some conversation among the panelists back and forth, challenging each other, supporting each other, and so forth. But then there'll also be that opportunity for Q&A, right? And so if you're on site, what I want you to do is put your questions in Q&A. And I'm going to ask if you would put your name and affiliation, unless you're worried about retribution of some sort. But again, what we'll do is try to get through a number of those questions as best as we can. So again, I want to thank the Hixon Center for Urban Ecology to host this. And what I want to do is to get started with us. And so where I wanted to start was to have Albert Coe come up and give us some perspective first on COVID-19, right? What's the global picture and how's that come to fit together? So I'm going to come and sit down. I'm going to ask Albert if he would come up.
Very good. Well, thank you very much, David, for that very kind introduction. And I guess Colleen, is the slide, I guess the first set of slides. So while the slides are coming up, I just want to thank the Hixon Center, and particularly Colleen and Karen, for the kind intervention in convening this panel. It's a real privilege to be by the sides of people like Blessing and Anna and Jason Corbin, who I think we've worked together for the last 15 years. Somewhat in Brazil and somewhat other places in the world, with a book chapter on the topic of urban slums and urban slum health. So I think the first slide is up. Okay, good. Yeah, so I think and is very appreciative of both Colleen and her foresight, of the pandemic for this workshop. To focus in on really one of the populations that we would consider the most vulnerable during this pandemic, which are those that reside in informal settlements. But before going into that, I think we wanted to reflect on where we are right now and really the devastating pandemic that we've experienced. As Karen said, we've had over 240 million cases, 250 million cases, roughly 5 million deaths. Here alone in the United States, we've had roughly about 750,000 deaths. Just in the last 2 or 3 months, during our last Delta wave, we've had 100,000 deaths, which one could argue would be all preventable. But those numbers are really just the tip of the iceberg, and they really don't capture really the deaths directly attributable to COVID or indirectly attributable to COVID. Because of difficulties in access to testing and reporting, the excess deaths significantly exceed those that have been reported to our surveillance authorities, both nationally and internationally. And this plays out particularly when we think of the Delta epidemic in India, where there are 300,000 deaths reported within about 3 months. Probably the real numbers, there have been estimates of over that maybe 3 million of the population of India died during those 3 months of that really horrific the initial Delta wave before it spread throughout the world. And then I think one of the topics of today in the discussion is really the indirect effects of COVID-19 on overall mortality, morbidity. And we still haven't gotten our head around about the additional indirect effects on the cognitive development of our children, of the broader impacts onto the well-being of our populations, including those that are most vulnerable in informal settlements. So next slide, please. So the next slide, next click. Yeah. So I think one of the things, and I think Dr. Snowden's keynote talk really played this out, the vulnerability of cities during pandemics, but particularly during this COVID pandemic. And you can see on the left-hand side, the air travel at the world's 500 largest airports, and you can superimpose that map on really what was the transmission in the first 3 or 4 months during our first initial global wave of COVID, and which really highlights that particular vulnerability that cities have felt during the brunt, in taking the brunt of the pandemic. Next slide, please. But just to end up and to kind of prime for the next sets of presentation, the discussion, but those burdens have been unequal. They've been unequal between regions, within between cities, between rural and urban centers, and within informal settlements, within cities, and social gradients within populations. And I think one of the unfortunate themes that we've witnessed is really how the pandemic has exacerbated inequities at very different levels of scale and geography and population. You can see on the map, many of the most populated worlds actually, one could say, dodge the bullet. If you look at places like New Zealand, Australia, Korea, many of the large metropolitan centers in Asia. And this is actually a map of the estimated excess mortality rates, to address some of the issues of underreporting. This is from the Institute of Health Metrics and Economics in University of Washington. But I think it captures some of the telling questions that we still have not answered. And who's vulnerable? Who has suffered? What are the costs of those? So let me just now hand this over to the next speaker, David, so that we can get into the meat of the discussion.
All right, Albert, thank you very much. That was a great overview on COVID-19, just to get us centered on that particular angle of the topic that we're talking about this morning. The second speaker that we have is Anna Diaz Rue, who will be giving us a brief overview of cerebral as framed around the social determinants of health. So we look at particular areas of the city, but we're also looking at cities as systems. And again, so Anna, if I can turn to you now, please.
Yes, hi, good morning, everybody. Thank you so much for having me. I'm going to share a few reflections broadly on urban inequities and the implications that these may have for COVID-19 and beyond. And I think this, in thinking about the role of urban slums, or informal settlements, it's important to put these in context of the broader structural factors that are driving inequities in general in cities. I've organized, I have 4 facts that I want to share with you. The first fact, which will not be news to you, is that cities are characterized by diversity and inequality. We see this very clearly in the United States, for example, where counties that are more urban are much more diverse. And we also see large social inequities across races, large racial inequities, for example. There are also income inequities, of course, and poverty inequities, and these have been growing over time. In the United States, you see increases in the number of high poverty neighborhoods, increasing wage inequality, but also globally, inequity, social inequities characterize global cities as well. Gini coefficients on the left tend to be higher for urban than for rural areas across the globe. And although the slide on the left shows the data for Latin America, although there has been some decline over time, there have been recent increases, and the pandemic, of course, has exacerbated this. Also, the percent of population living in slums is extraordinarily high across many parts of the world. And although it has been declining in some cases, again, we'll have to see what COVID is doing to this. We already know the impact that it's starting to have, but the absolute number of slum dwellers has increased, continues to increase dramatically. The second fact, which is a consequence of the first, is that these social and racial inequities translate into health inequities. We see this dramatically in large racial inequities in health, particularly in urban areas in the United States. These racial inequities tend to be larger in urban areas than in other areas. We see a very dose response gradient of patterning, for example, of life expectancy by income in cities. The figure on the right shows examples for 4 US cities. And we also see these in cities across the globe. This is an example at the bottom, data from the Salurval study that David mentioned, a Latin American study. This is pooling data across 232 cities, across 9 Latin American countries. Dramatic differences, not just in infectious diseases and violence, as is often talked about, but also in chronic diseases, in this case, diabetes, strong social gradients in diabetes, for example. These inequities are also manifested spatially within cities through very large differences in life expectancy across small areas within cities. This has been shown again and again for US cities, but we are finding this as a very similar pattern in cities in Latin America as part of the Salurval study, for example. COVID-19, of course, has revealed this, illustrated this, I should say, even more. This is data from the United States showing the patterning of COVID testing, positivity cases, and deaths by zip code in 3 US cities. And on the right, also vaccination rates, with very few exceptions, a couple of cities in California, the percent fully vaccinated, it also varies by neighborhood, socioeconomic characteristics within cities. These inequities in COVID are also present across cities of the world. This is data from Salurval, again, showing, for example, how within Mexico, cities with better living conditions have lower COVID-19 positivity, which is an indication of transmission. In addition, within cities, this is an example of Santiago, Chile, areas within the city that have higher educational attainment have lower COVID incidence. And once again, vaccination is also patterned very dramatically. Now, what drives these differences? These differences are driven by processes and factors that are structural and systemic. And these words I know are used a lot, so I'd like to define them precisely. Structural relates to the arrangement and relations between parts or elements of a complex whole, and systemic relates to the functioning of a system. And these structures and systems encompass but go beyond healthcare, important as healthcare is. Residential segregation, for example, is one key driver of urban health inequities, driven by economic inequality and racism. It creates reinforcing feedback loops between area composition and area empowerment and resources, which have consequences for neighborhood environments, which in turn affect many processes that lead to health. And this is manifested across the life course and also across generations, which is what makes these drivers so pervasive and fundamental, that they're operating not only during a person's life course, but also a person is affected by intergenerational processes. COVID, of course, is no exception. Income inequality and structural racism drive differences in neighborhood work conditions as well. So not just residential segregation, but also work environments, which influence many factors that we know are related to the process of COVID. Distal factors, multiple interacting factors, a system that's generating these inequities. And as a consequence of this, because these are systemic causes, we really need multi-sectoral approaches to reduce urban health inequities. If you think globally, urban health inequities and urban inequities in general need to be placed within a broader context of what's happening globally, what's happening more locally, how does this sort of get under the skin through specific mechanisms. But urban policies and interventions are at the core here and can affect all these processes. And this includes the actions of government as well as the actions of other actors, both within the health sector, but also, as I indicated previously, and most importantly, outside of the health care sector. So these are my 4 facts. Cities are characterized by diversity and inequality. Social and racial inequities translate into health inequities. The drivers of urban health inequities are structural and systemic, and multi-sectoral approaches are needed to reduce urban health inequities. What have we learned from COVID-19? And here I highlight my top lessons. There are many others. It was hard to choose. First, I think COVID has shown us the challenges of obtaining the data necessary to adequately document inequities, guide actions, and evaluate the impact of what we do. We have some data, but in many parts of the world and even in the United States, this has proven to be much more challenging, I think, than many of us expected. The role of systemic and structural factors, we need new ways of thinking about the causes of health in cities, the links between health and the urban environment, and what can be done. Most importantly, what can be done. The interrelatedness of health and environmental sustainability outcomes. I didn't have time to elaborate on this, but there are many ways in which the policies that we can implement to improve health and reduce health inequities can have beneficial environmental sustainability outcomes and vice versa. We saw the interaction between COVID and air pollution, for example. There are many, many examples. The need for bold new initiatives that have multi-sectoral approaches to improving health in cities and reducing urban health inequities at their core as a fundamental driver. And last but not least, the need to empower and engage those most affected as we move forward. So I'll stop there. Thank you very much. I look forward to the conversation.
Thank you, Anna. That was absolutely fantastic. It really, I think, was very comprehensive in terms of the implications that we need to be taking into consideration. I now want to turn to the next speaker, Blessing Maburu from the African Population Health Research Center. This center, housed in Nairobi, has been one of the leading research centers in Africa and has really put out a lot of new knowledge, and particularly putting emphasis on disaggregating data to be able to look specifically at slum health. And so what I want to do is to ask Blessing, talk about disaggregation of cities to identify slum environments and health, and as this relates to COVID-19. Blessing?
Yeah, thank you, David. Thanks, everyone. Yes, you are right. Again, greetings from Nairobi. It's already after 4 here, it's 4:25. So we've had a long day. But to go back to your question, the challenge we have, not just with COVID, but generally, is that when you look at cities and data out of cities, you have local average, urban averages. Okay, you have national indicators talking about urban versus rural and so on. But the reality is that there's a lot of intra-city inequities, a lot of missing data in the cities. If you look at Nairobi, for instance, Nairobi has over 60% of Nairobi are actually informal settlements, which we call slums for effect. And you know, these are where these problems exist. These problems are local. These problems are local, okay? So national averages doesn't capture it. A lot of local authorities, they lack evidence at the local level to be able to pinpoint priorities, to even evaluate interventions, what has worked, what has not worked, okay? To be able to talk about how to move forward. So one of the things we have done is to actually, we set up for the last 20 years, Nairobi Urban Health Demographic Surveillance System, which is looking at some selected slums in the city so that you're able to know what is happening among the urban poor when you now look at national indicators. So, and that has given us a lot of room to be able to say what is happening among the urban poor, who are, by the way, the most vulnerable, even when you come to pandemics and for example, COVID. So I want to just highlight key things we have seen about COVID as it relates to the urban poor in the slums. One of that came out is when this pandemic came up, the responses were like global. Eventually it became national, but it didn't take account of this local context. So most of the responses, official responses to COVID, were inconsistent with the livelihood and living space of the urban poor. And I can take that briefly, David, if I may. Most slum dwellers are informal workers. They are daily wage earners. So staying at home, lockdown, quarantine at home, work from home, social distancing are not consistent with their lives. They have to go to work. They can't work from home. Most of them are just laborers, gardeners. They have to appear on location. And most of them earn daily wages. So for that reason, lockdown, which was almost like the default response, shut them out from livelihood. The other issue is that because they are wage earners, they have to, the market must be open, because for them to survive, they don't have the capacity to buy things in bulk. They buy on a daily basis. And so the response shut them out and created huge crisis within these places. The other issue is neighborhood effects. These places are already overcrowded. But most of the time, you notice that in the evening when everybody comes home. So they shut down, made everybody to be at home. And when you talk about home, you have to understand what that means, because these are makeshift homes, very hot during the sun, very cold in the night. So people really want to get out of these homes, but they are now shut down in these places. And again, most of these rooms are supposed to be, the space is not there. You have so many people, 4 or 5 persons living in a room, and they don't have balconies, they don't have other spaces outside. So overall, what we saw was that the COVID response didn't take care of this context. Quickly, most of these people are already living in some form of perpetual emergencies. Okay, we call that perpetual emergency because they lack basic infrastructure, they have limited or total lack of access to social services. There is the near absence of the public sector. So these are then exacerbated by COVID-19 pandemic and the disruptions it caused in their livelihood, in the service delivery value chain. So the responses that was enforced and are still being enforced, almost in a draconian top-down way, did not seem to take cognizance of these challenges in the informal settlements. The slum residents in Kenya, they operate in what is called kidogo economy, and I made that point earlier, which is small package systems, a bag or two of tea bags, small sugar packs, small tomato paste, small quantity of food, small liters of water and oil and kerosene. So they need the market to be open daily, and a little shock rocks their whole world, push most of them to deeper poverty, moves some of them to food insecurity and associated hazards. So that was why it was difficult for them to even, save themselves. Even when they know the reality of COVID, most of them could not respond. And I think the last speaker mentioned the structural issues. And I think that is one of the things that the responses did not address. And that problem is still there. We don't know. We started looking at it, but we need to do a lot of rigorous analysis to be able to show the level of poverty that is exacerbated by this challenge. And just to round up on this matter, David, I want to say that there is, following the first speaker, there is a light on the end of the tunnel, which is that there are 2 responses I want to highlight. One is response in the short run, addressing immediate needs and disruptions associated with COVID-19, particularly retracing the responses that were imposed. In Kenya now, there are a lot of movement towards opening the economy so that at least people can survive. The second, and I think that is more fundamental, is in the long run. How do we address the structural issues of inequity in society? When you talk about universal health coverage, you talk about leave no one behind, promoting human dignity, and all the SDGs. How do we reach there? By addressing the inequities that have been there, but exacerbated by COVID. Just to finalize it, I want to go back to where I started. Investment in data systems is key. Evidence generation is what is needed as we move forward, particularly for local context. It's very interesting that Anne was able to present data across the US. But you know how difficult it is to do that in any city in Africa. So we need a lot of investment in evidence generation. And I think the capacity to do that is here. And at APHRC, we are currently working with University of Ottawa to be able to get funding from CHIR to be able to look at the impact of COVID on informal settlements. So I'm very happy for this discussion. Thank you very much.
Blessing, thank you very much. So far we've talked about COVID overall, the epidemiology, some of the implications, and then we've talked about the social determinants of health and the health inequalities. And now we've had the perspective here of looking at some of the conditions and challenges in the informal settlements, and specifically the experience in Africa. So now I want to turn to Jason Corburn, who brings a lot of these parts together and has done some thinking, led groups about what kinds of responses that we should be thinking about for COVID and in the informal settlements around the world. So Jason, I'm going to turn it over to you at this point.
Okay, thank you, David. Thank you, Albert. Can you see my screen?
Yes.
Okay, great. Well, thanks again. And I'm going to try to build on, for sure, what Anna and Blessing have just said, and maybe be a little provocative for our discussion. I'm going to start with, David mentioned at the outset, a paper that we co-authored, including almost all of us in this panel, on some of our thoughts pre or as COVID was emerging, and the impacts that this pandemic might have on informal settlements and informal settlement workers and communities in general. So on the left, what you're seeing are 8 suggestions that we put in that paper based on our colleagues and our partnerships and our experience around the world, from Asia to Africa to Latin America. And so those things, I'll read them off quickly and give you my reflections on where I think we are today. So the first was that we need to utilize local expert knowledge in our response to manage the risks of the disease. We need to ensure that people have the right to remain in place in their communities and in their homes. They needed immediate payments to the poor, in part because of lack of work and the daily wages Blessing talked about. We needed to utilize community health workers in a much more robust way, folks who've been effective around the world supporting community health. Invest in basics of life supporting services, water and sanitation in particular, and food assistance, especially immediately, to focus on the environmental issues like Anna mentioned, including solid waste collection, and a mobility plan, a transportation plan for people to get access to care when they will need it. Those were the things we suggested in March 2020. On the right, I'm suggesting where we are today. And again, trying to be a bit provocative here, that the reality is that we're still relying on professional models, and that our professional expertise will sort of ride in on our white horse to save us and not utilizing that local knowledge. There are still forced evictions, creating greater risk and insecurity and death, as I'll show in a moment. As Blessing mentioned, the plight of informal workers has largely been ignored. So when we talk about informal settlements, we also must think about the informal workers. Clinics and hospitals not necessarily community sites have been the places of care. Some places that's worked, others it has not, for a host of reasons. Community innovators delivered water and sanitation, not the state, and often not a priority of the public health and medical community. The response to food has been haphazard, as Blessing mentioned. Many workers were committed to getting that daily wage and eating, and they this was a quote from one of our partners in India: "I'd rather die of COVID than starve to death." Almost no environmental management, and isolation centers in places had disproportionate impacts. I think Albert mentioned mental health, risks to women and children, and the disabled populations have been disproportionately harmed. So not a pretty picture. And I think we have to ask ourselves, what have we done right, and what have been the failures of our field of public health and public policy? A recent UNICEF report really sort of scathing, saying that decades of work on children's health, food security, gender rights, and poverty have been reversed through COVID-19 policies. So it's both about, as folks have already mentioned, the disease, but how have we responded in different parts of the world, and what have been the impacts? One impact of enforcement of safety in the name of safety, lockdowns and curfews, has really harmed the poor disproportionately. This is, as Blessing knows, what happened in Nairobi, Kenya, but this was happening around the world. The police enforcement, disproportionate on the poor and young people, particularly often young men, people being killed to enforce a curfew that was supposed to save them. Forced evictions are still happening in informal settlements, often in the name of infectious disease protection. We need to space people out, get them out of here. But they've just displaced them and made them more at risk, without housing, without their social connections, without their livelihood opportunities. These lockdowns have disproportionately hurt the poor, as folks have already mentioned, while many elites benefited because they could work from home. Lots of data and studies coming out. This is just one example of not just the economic, but the mental health impacts of folks in urban informal settlements. This is from Dhaka, Bangladesh, of slum dwellers reporting greater food and income insecurity, more suicides than deaths from COVID. And we have to, check the accuracy of some of these data, but what we're seeing is particularly disproportionately hurting women, and hurting already marginalized populations. In this study in Dhaka, of the transgender community facing increased discrimination during the pandemic. So these one-size-fits-all public health measures have really hurt those in informal settlements severely, I would argue. Much more so, of course, than middle class and upper class folks, even in cities around the world that do have informal settlements. This was a protest by folks with disabilities, could not move around, made it illegal for them to move around to get the care, the support, the food that they needed. But there were many examples, and there continue to be many examples of community-led responses, community-led science and health. On your left, you're seeing women distributing food in Nairobi, and also NGOs, non-governmental groups, creating some of the infrastructure that doesn't exist, water and sanitation and energy, to ensure people can social distance and can remain healthy in their communities. This is from the Philippines, Cebu City, community groups mapping vulnerable households that may have had an elderly person or children or a person with disabilities, so that they could target very more a precision public health, as we like to say, a focus on who's most vulnerable, not just a broad approach to the entire community, even in informal settlements. And on your right, you're seeing these community kitchens that were so instrumental in feeding folks around the world. So it wasn't enough to give people food because they didn't have energy to cook it, or they didn't have enough resources to cook. They needed to actually get warm food delivered to them. And this was important, not just in the Philippines, but in India and many other informal settlements. Folks talked about data and information and the lack thereof. And this is just one example from a partner of ours called Catalytic Communities in Rio de Janeiro, where they worked with local residents in the favelas to map cases and deaths from COVID, and was a very important data source when the state really lacked information. And this was also a partnership with Fiocruz, which is the public health agency. So there were important community, state, and public health partnerships that emerged or were built upon. This was already a partnership that provided important information, again, to target and focus in supportive interventions in the most vulnerable places. And what we've seen is that there's an emerging kind of conversation about how these models of responses by those living in informal settlements, in this case, Dharavi in Mumbai, one of the largest slums in the world, definitely the largest in Asia, as a global model for managing COVID. How did they do it? How did they keep cases and deaths way down in one of the most dense places in the world? So it wasn't density. It was how did we respond? And by we, often community members, the medical and public health community, supporting people to have those basic supports to live their life: food, water, sanitation, energy, but also social connection and work was important to keep Dharavi safe. Even though the folks have made the statement about the importance of data and information and being able to show that intra-city and even intra-neighborhood differences, I think we also have to be have a healthy skepticism of this increased surveillance and use of data and tracking. It often disproportionately impacts the urban poor, telling them, "Wait, we need data on you to know if you're healthy or if you're making good decisions." But it also is leading to censorship and criminalizing the poor, often urban youth, often in the name of public health. And so, and we're not seeing this just in the wealthy parts of the world, we're seeing this all over the place. So while data are important, I would argue that it's less important than the political will for action, particularly in informal settlements. So where do we go from here? I went through this quite quickly, but I think the previous speakers have really framed the issues nicely. I think we need a greater criticism and what I call and what others have called an extended peer review, both of our models of who's at risk, but also the policy recommendations. We seem to have lost the risk-benefit framework of who's really going to benefit and who may be burdened by some of our policy recommendations during this pandemic. Greater meaningful engagement with these citizen scientists who have shown time and again that they can innovate in ways and know about opportunities to promote health and well-being and even collect data as well or better than us experts, quote unquote experts, living outside community. So important partnerships to create the citizen science opportunities. Greater attention to supporting health, as Anna really, I think, drove home importantly. We have focused so much on a disease or a risk in many places, as I've mentioned, and I can give many, many more examples, that we've lost the focus on what makes people healthy. And we've lost that focus on the basics of food, livelihoods, water, sanitation, and social connection. And it's still frustrating to me and many of my partners, and I don't speak for them, I speak so hopefully with them, the frustration even today of why it's still easier to access a quote unquote smartphone in most informal settlements than get the basic flush toilet that you and I would expect in your daily life. So I'll leave it there, and I think we have plenty to reflect on and discuss. And I'll turn it back to David and Albert.
Jason, that was certainly a comprehensive review, and so thank you very much. What I wanted to do next was to ask Albert if he could tell us a little bit about some of his thoughts and experiences from his recent sabbatical where he was in Brazil. And so I'm going to turn the mic over to you.
Okay, thank you very much, David, for that. And as David said, I've just returned for the last couple of months in Brazil, but we've been working there for the last 20 years through successive waves of pandemics, whether it's first meningitis, Zika, dengue, and so forth. So now we've are our team, which is very much based in the communities, in the peri-urban communities in the city of Salvador, have been specifically, I'll talk about their experience, but maybe you can put up the slide. Great, okay. Yeah, so the discussion has been very, I've learned a lot for the last three speakers, from Anna, Blessing, and Jason, and many of the points I'll make, will resonate with many of the assertions that they put forward. I'm going to try to focus on a very specific question about how do we mitigate harm due to the pandemic in the informal settlements in the setting of this emergency, and what evolved. And I'll give two snapshots. One, what happened as David had mentioned, with our team and our communities and community health workers in the city of Salvador, Brazil, which is the third largest city in the country of Brazil, and also our experiences here in Connecticut and how they interpose. But let's go back to kind of the public health centric or medico-centric toolbox that we've had, and that's laid out there: tertiary care, testing, non-pharmaceutical interventions, and vaccinations. And that's pretty much about what that very specific, very top-down kind of toolbox did in addressing that the burden of disease, and how that is actually quite inadequate. Next slide. As I think Jason eloquently labeled, and just to give this snapshot of what happened in Brazil. So this is a community, there's a community of Pau de Lima, which we've been working in doing long-term cohorts since 2002. And this is the experience of what they had during the epidemic. You can see in the lower right-hand corner, this is the epidemic curve. In red are the number of cases of COVID that happened in the city of Salvador. You can see there are two peaks. That second peak was due to the dissemination of the Gamma variant, which originated in the city of Manaus, spread very quickly through Brazil and much of South America. During that one peak in Brazil, 300,000 Brazilians lost their lives. And that we just to understand what happened in an informal settlement, or this peri-urban slum community, which very much captures what Blessing had said, is that you can see the first seroprevalence survey we did before the pandemic, and this is on the blue, the axis on the right-hand column. In the blue is the antibody titers to the SARS-CoV-2 virus. And you can see, of course, there's no transmission or no exposure to SARS-CoV-2 prior to the pandemic. After that first wave, 50% of the population were infected in a very short period of time. And then after that second wave, an additional 50% of the people who were not infected by the first got infected. So roughly 75% of the population were exposed to SARS-CoV-2. So this is the real proverbial let it rip scenario. Next slide. And these are surveys of over 2,000 people. And when we looked at the data, and this highlights many of the issues that Blessing and Anna raised, is that who are the most vulnerable during that? And we see a snapshot that's very different to our experiences here in the United States or in the upper income countries, including in Europe and Asia. And the most vulnerable, the highest rates of exposure infection were in the children. 60% of the children were infected. And these were times when schools were closed during this whole period. So, rather than taking kids out of the safe environment of the school, and now they're in their homes, facing many of the high-risk settings in the community. And you can see on that left-hand side curve that also there was differences between genders that happened over age. I'll come back to that in a second. But I think the other part that comes out, and this is a community, so 15% or 20% of the Brazilian population live in conditions, just as I showed in the previous slide, in these in an urban slum setting. And you can see in our population, half the population live on less than 2.5 US dollars per day. And you can see even in this poor community, you can see how social gradients or gradients in socioeconomic status affect exposure. And that difference also breaks down between genders. You can see that women, and this is in the red, on the right-hand side, the red dots and bars, women, among poor women, or the ones that, are the poorest segments, the women have a much higher risk than the men do. So you can see how vulnerabilities on very different levels across gender, across age, and across socioeconomic status interplay in this. Much of that risk of children, that astounding 60%, when this same time we did surveys here in Connecticut, and the seroprevalence among children were less than 1%, 2%, compared to 5 or 6% in the adult population. And you can see that these interactions, a lot of that was exactly what Blessing had mentioned, that children, not necessarily because they were children, but because they lived in crowded households. Most children live in households which have higher density, and that was the driving force. Next slide, please. So this gets back to how do we come up? First of all, why do we come up with a model? And that's because we want to act on it. And the model here is, really addresses many of the distal and the proximal factors that Anna presented in her discussion. And the age, gender, household structure, household crowding, socioeconomic status, these social determinants of health that place people at risk. And this is just infection. We're not talking about the downstream issues that Jason raised very eloquently about access to medical care, testing, access to healthcare, access to oxygen, and so forth. So what is actionable about that when you have a pandemic that comes into a vulnerable community with complex interactions? Next slide. So let me give an opposing example, and that, not necessarily opposing, but an overlapping example of that in Connecticut. And what happened to our vulnerable populations and what could potentially be done. So this is the epidemic curve. You could see our first wave, and much of that first wave was due to deaths. These are deaths, weekly deaths, were deaths in congregate settings in the vulnerable population of our nursing homes. 11% of all our nursing home residents died in that first wave in early 2020. And then you can see the second wave that occurred. You could see a little blip at the end after that, which was the introduction of the Alpha variant. And you can see the much lesser wave that we've experienced recently because of the Delta wave. And this goes back to just exemplify some of the points that Anna had raised, but we have the 5 largest cities in the state. The first is Bridgeport, second is Stamford, Hartford, New Haven, and Waterbury. You can see the population density, the social vulnerability, that overlap between cities, urbanization, and social vulnerability. And you can see how that map overlays with the mortality. So going back to what Dr. Snowden had initially said about the vulnerability of the cities and the high mortality that we experienced during the COVID pandemic. Next slide. But there's something that happened, and when we think of the disparities, and really the stark disparities that we saw during the first wave in our state, you can see in orange is mortality, age-adjusted COVID-related mortality among our African-American population. You can see in purple the age-adjusted mortality for our Latinx population, and in green and white. And you can see that we had huge disparities coming into this pandemic, where in our Black population, they had 5 to 6 times higher risk of dying from COVID during that first wave. But you can see how that evolved over the second wave and third wave. And you can see this is, again, and we can debate about the effectiveness of top-down decisions, but access to testing. In the first wave, we had no access to testing, and people were told stay at home if you were sick, and only come to the hospital if you're extremely in extremis. And you can see how that disproportionately affected our not racial ethnic groups, but also, also those who are most vulnerable. And you can see how that was mitigated in the second. So for the African American population, those mortality rate ratios, those disparities went from 5 to 6 to roughly two times, which is still unacceptable. But you can see that decrease that we saw in disparities with our African American population was not experienced with our Latinx population. So that really gets to the issues that I think Jason raised and Blessing raised, that we have to understand our communities, and we have to understand, not only understand the communities, but we also have to promote those activities and promote the health actions initiated by those communities. Next slide. So these are kind of my lessons learned on this. I think Jason makes a good point that governance doesn't necessarily come up with a solution, but certainly bad governance, can get it wrong and can do a lot of damage. And we've seen that in our country. We've seen that certainly in Brazil with President Bolsonaro and his policies. But I think the other key part of that is the policy decisions that those in governance make. And I think where you've seen it with the states and countries, those that have prioritized health and social protection, food security, and so forth, had the best outcomes worldwide, whether at a country level, regional level, or whether at a granular community or city level. The second is, I think, they're just the example of what happened in that one urban slum community in Brazil really keys into the challenges of implementing non-pharmaceutical interventions, given the underlying social determinants. So if you start behind the curve, you will always be behind the curve. And that really goes back to I think the assertions of Anna, Blessing, and Jason, that we have to get out ourselves in the curve. We have to be proactive. I think one of the big issues is that we need to make sure that all the tools that we have in our prevention and control toolbox, are used to promote equity rather than enhance equity. And this is starkly demonstrated by the map of who's vaccinated and not vaccinated in the world. And then, I think when we're moving ahead, what we haven't done is we haven't really done the types of analyses to really understand what was the true cost of the pandemic, particularly for those most vulnerable, those in informal settlements. And to understand that so that we can make the investment case for addressing many of the things on the list, on Anna's wish list, on Blessing's wish list, and on Jason's wish list, about making the investment case for addressing those social determinants, improving the health status of the vulnerable populations. And we've seen that play out badly here in New Haven with the high rates of obesity, diabetes, hypertension, which were all setups for mortality and morbidity from COVID. So let me stop there, and thank you again, the speakers who preceded me and David.
All right, Albert, that really pulled together a lot of points and gave some very concrete examples in terms of the international picture as well as domestic for us here in New Haven, where we're having this conference today. As I'm listening across all the speakers here, one of the questions I have is, what have we learned so far? What have we learned so far that can shape how we would be thinking about planning for the future, right? What are some of the lessons that we have now in terms of putting together preparedness plan and dealing with the issues of informal settlements in particular? So that's one question. I've got another one after that, but let's deal with this one first. And I'm going to, let's see, who should I start off with? Jason?
Okay. Well, I think all of us have put forth some lessons to think about the response and moving forward. I had said a few things at the end of my little slide presentation. First of all, I think we need to as Anna, I think, really emphasized, rethink what are we doing in public health. And this is not a slight to the ID folks who I work with often, but that we invest too much, I think, in thinking a disease risk factor, meaning like one behavior or one exposure at a time focus. And we need to, as a community of health scholars and practitioners, get back to what I call some of the life supporting basics of housing, of food, of water and sanitation. And that's going to make people more resilient, communities more resilient in a number of ways, not just to an infectious disease outbreak, but to a number of things. And this is also fundamental for poverty alleviation. I think we also need to pay attention to the importance of social connection and social supports, both in an emergency and in the everyday health and well-being of communities. Now, it's not just the middle class and wealthy that are able to tap into their social networks to make themselves healthy and wealthy, but it's also important for the poor, especially the poor, to have those social connections. And when we disrupt that through policy responses or through medically driven interventions, we are actually potentially harming communities in very detrimental ways. So ensuring, and this is also important, I think we've seen in responses to heat events, floods, other kinds of natural and environmental risks, that it's not just the physical infrastructure, but what folks call the social infrastructure that we need to support and lift up and maintain in a ongoing way, so that when an emergency, that everyday emergency that Blessing talked about, that perpetual emergency that should be really unacceptable to us, continues, particularly for the urban poor and in informal settlements, that there's some resource to support folks and to ensure that they thrive. And finally, we really need to invest deeply in changing living conditions and the poverty conditions for the urban poor. We have spent way too much focus on more rural areas and on other issues, again, single diseases and single factors, and not got into that messy complexity that Anna talked about, which are cities. But that's really where we see 50, 60%, 70% of folks living in what should be completely unacceptable living and working and playing conditions around the world.
Thank you, Jason. Let me extend that a little bit and go to Blessing on this one, which is, we're not over this pandemic, and there are going to be ones coming up in the future. And what we've seen are the public health kinds of challenges, like social distancing, masking, shutdowns, and so forth. Are there strategies that, when we're in such dense environments right now, where these kinds of public health practices are seen by people as something that really can be done, or are there alternatives in the short term?
Thank you, David, and thanks everyone. I mean, this is a very great learning opportunity. Yes, I mean, it's I think the keynote speaker talks about good news and bad news. I don't think there is a yes or no answer. It has to depend on what we are dealing with and the context. And Jason, I hear you about increasing surveillance, but that is actually around big data and big technology. My point remains, David, that investment in evidence generation at the local level, I don't think there's an alternative. I'm talking from Africa. We can't continue shooting in the dark. So data is key. If you can measure it, if you can define it, it becomes easier to talk about how to address it. And when we are talking about evidence generation, what I'm actually looking at is science with new methodologies, and we have developed some of them and we are trying them out under these circumstances. citizen scientists, collecting data with young people. So many young people are around. They have cell phones. You know, they can actually use their cell phone to become data collectors. And in some of the projects we are doing, we call them co-researchers from the local community. You know, they do photo voice and use photographs to show you life in the community. So co-researchers, citizen scientists, you know, and then the whole issue around participatory approaches, where you work with communities to co-identify problems, because sometimes we really think we know the problems. Okay, you know, we used to say in history, Mungo Park discovered the River Niger. Come on, people have lived there forever. He just came from somewhere in the United Kingdom and ran through a river. Then they say he discovered it. No, these places have been there. These guys have resilience. They have understanding of their context. So co-identification of problems and co-creation of solutions. I think that is what this opportunity, this situation has called for. But system dynamics modeling, okay, where the whole idea of interdisciplinarity and even transdisciplinarity can become the new scientific norms, where you have people come from different directions. And I think that is what the SDG was about. The MDG was more siloed, but the SDG spoke about collaboration beyond the siloed response to issues. So there are solutions, but those solutions can be local as well as international, but there must be that synergy, okay? So that, for example, you have responses by Ministry of Health, but they have to work with the Ministry of Water and Sanitation. I mean, how do you wash your hands? Just showed the group that were providing water. You know, it was actually non-governmental organizations. But even when the government provided water, how does a 70-year-old man stand on that line to get it? How does somebody living with disability get the water? Because the water it comes once in a while, and there's a lot of other struggle, okay? So collaboration is required. In many places, there was no water at all. So how do you keep sanitation? Like Jason said, there are some places that have no toilets, okay? So the health sector, the housing sector, you ask people to work from home. Which home? How does many of them actually sleep around? I watch a documentary on Bangladesh. Those rickshaw drivers, they just park somewhere and sleep on the rickshaw. So where would they quarantine at home? People who live under bridges in Lagos, where is their home? So in essence, there are many opportunities, but these opportunities require a lot of collaboration. Ministry of Labor and Employment. Okay, let me list quickly the people who are most vulnerable, at least from what we saw. Young people who are not in employment, not in education, and not in training. They are not employed. They are so vulnerable because they can't even move around to look for a job. They will be arrested and laid on the street like Justice showed. I mean, it was not just in Nairobi, in Lagos, in Nigeria. The time they said curfew, in one day, 15 persons were shot dead. Okay, so and yet those people were not even infected by COVID. So in essence, there are a lot of groups that are most vulnerable. Older persons, people with disability. Let me give this instance, child-headed households, and there are many of them. You know that when the schools were shut down, many of these kids go to school. The real meal they eat in a day is actually that school feeding. And so when the schools were shut, we shut them out from even opportunity for a meal a day. So in essence, therefore, understanding local context, working with a lot of stakeholders, both at the local and national levels, will bring solutions. And that solution is not easy to dictate what it is until you interact with the community and the stakeholders. Thank you very much.
Thank you, Blessing. Anna, I'm going to turn to you because it's come up in the conversation here a number of times, and it's something that really builds on your most recent experience, which is data systems. and structuring them. What's the experience? What are some examples? Some thoughts on that. I'd appreciate that, as it addresses, the issues we're talking about today.
Yeah, I mean, I think the issue of data and data systems, I mean, I totally agree with what Jason was saying. I think we need to, having information is useful. I mean, there's no question about that. But the question is, how do we gather that information? How do we make it useful for people, right? So that it's not just a scientific exercise or even a public health surveillance exercise, but it's something that can empower local action. And so I think that's key. And I think we have seen with COVID illustrations of situations where the absence of data obfuscated inequities, right? So the prime example is particularly early on in the pandemic, when there was, very little data on differences by race in the United States, a premier, very rich country with probably the premier, public health research infrastructure and public health institute, the CDC, in the world. And yet we had no data. We had very little data. And even today, there's a lot of missing data on a very fundamental driver of health inequities linked to racism, of course. So I think, the lesson I think that we've learned is that it's that we need to invest and maintain those systems in ways that make them locally useful. And that is not only using for research or for fancy surveillance, it's for, for empowering and understanding what's going on. I also wanted, if I may, I just wanted to make a comment on the earlier question. I think the key lesson from me from COVID, I mean, there are two key lessons. One is that, it was absolutely no surprise that COVID was distributed the way it was. I mean, this was totally predictable, right? And because the underlying drivers of the distribution of infectious diseases and other diseases in cities have to do with these social and environmental factors. And even when biomedicine overcomes COVID, which it will, we're seeing vaccines, we're seeing treatments, we've been successful with many diseases, something else will emerge and will follow a similar pattern. And so I think this is the lesson here, is that we really need to address these structural inequities that have to do with differences in environments, differences in work conditions that are really underlying the distribution of disease. And the other big lesson, I think, is that I think the experience of COVID, I mean, it has been in many ways so mixed, but I mean, it's illustrated a lot about our society, right? On one hand, we saw governments that were ignoring evidence, ignoring, misinforming their own populations. We saw well-intentioned public health measures sometimes being implemented in authoritarian ways, and also with disregard for their, sometimes, without fully acknowledging all their other consequences, as Jason was saying. But we also saw things that I think illustrated that we can be organized differently. So, we saw, for example, this was in crisis, but it still illustrated dramatic declines in greenhouse gas emissions, for example, associated with the lockdowns. Of course, that's not sustainable over time, but it shows that what we do has a lot to do with the greenhouse gas emissions. And also, we saw in the United States payments to individuals that dramatically reduced poverty rates. We can talk about how is that sustainable, et cetera, but poverty rates were reduced, I mean, dramatically. So we saw a moratorium on evictions for health reasons. So I think we really need to come together as a society and think about, as we come out of COVID, how can we build and govern cities so that they promote health equity, and so that their environmental is sustainable? We have an opportunity. Sadly, I think we may be missing the opportunity because we're a little bit coming back the way we were before, and perhaps even worse. So I think that's something that we have to be, not miss this opportunity and be, on top of.
Thank you, Anna. It gets me thinking of a follow-up to comments that you're making in some of the earlier ones. The African Population Health Research Center, like many countries, have done demographic health surveys, but APHRC is, I think, very famous in really informing us in the world of the one that oversampled in slums and the amount of information that came out of that. Certainly from your project, Anna, there's the examples of the Urban Health Observatories, right? And those are partnerships of government and academia, I think some citizen participation and so forth. Could you share some thoughts on how this might be something to capitalize on, to build on in ways that might be helpful going forward?
Yes, so the idea of the sort of urban health observatory movement in some way has been to create local infrastructure to support having information for action locally, and in a timely way, in a way that's useful to local residents, certainly to public health authorities and government action, but also in a way that empowers local residents to understand what's happening in their communities and be able to leverage that information for action. So I think it's a very interesting idea. I mean, what we've discovered in our project, which is a project called Salud Urbana in America Latina, Urban Health in Latin America, which spans 11 countries in Latin America. What we've discovered is that there is a remarkable amount of information out there that is often not used, that is not made visible. And that, of course, in order to make that information accessible and visible, important investments have to be made, work has to be done to make that accessible, and also so that meaning can be extracted from it. Meaning that is relevant to policy, meaning that is relevant to communities, to action, to change, and that illustrates some of these links that we're talking about very, very clearly. So I think there's a lot of promise in thinking about, how we may be able to move those kinds of initiatives forward in a way that's really action-oriented and that empowers citizens.
So Albert, as we're having part of a conversation about urban health observatories, thinking about the work that you do in infectious diseases, some thoughts about integration with urban health observatories, is that?
Yeah, well, so that's an obvious
Natural.
national need. I think it goes back to some of the points that certainly Anna and Jason have made. A couple things. One is that Jason's correct, and I think we've seen the fallacy of very disease-oriented, disease-specific vertical programs, and we were kind of like the dog biting its tail. We had dengue. And then, epidemics of dengue, once those go away, we have then epidemics of Zika, and we don't get at the underlying, social determinants. And I think Anna made that point very importantly. That same community that we work in, Jason noted very well, we had epidemic of leptospirosis, we have epidemics of dengue, Zika, chikungunya, now COVID. The determinants, social determinants of health, and the environmental determinants have different flavors and different, I'm sorry? They have have different, what do you call it, you know, they certainly have different transmission modes, certain different biologies, but the social determinants of health are important. Unless we get a handle on that, and I a little bit in contrast to what Jason had said, I think there is important data that we need to harness, and I think the observatory is important. Let me bring this issue a little bit closer to home. And Anna raised this point. I was called in by the governor to co-chair the Reopen Connecticut Advisory Group and to come up with the plan for the COVID response and provide recommendations on how to reopen Connecticut. This was in April 14th, right at the height of the pandemic in 2020. The only people who had insights about who was getting affected by COVID were the healthcare workers in the hospitals. They saw you go down the intensive care unit, half the people from nursing homes, half were from our Latino or our African-American communities. And it took us about 6 months or 7 months to get information on who was dying, where they were dying, and when they were dying because of our data set. So I see data and that type of flow of information as critical in terms of addressing issues of inequity. And I think this is, I'm not trying to make a false argument with Jason, but he's right. It's the type of data that's key in that sense. So I do see a central role, again, with the limitations that a lot of the decisions that we're making during a pandemic had to be very disease specific, and they had to be made with a lack of evidence many times in driving, particularly in the initial phase. Let me just make one quick comment about the steps ahead, and this is where there may be a little bit of discourse or distinctions in policy. Certainly, we're in a pandemic. We have a specific disease. There are things that we need to do that are very disease-oriented. Vaccination is one. And I think the questions of the social determinants come into the access of those vaccinations on many, many different scales. But that doesn't negate the fact that I think there's an imperative that we get our heads around, understand, what were the lessons learned, but also the mechanisms of vulnerability so that we can act in the future. Along the lines of getting back to the basics, I think Jason laid them out, food, housing. Here in Connecticut, one of the first things that we did, in response, was actually not only to set up testing centers, but to set up, to do food security surveys, to understand who was most vulnerable in the state so that social protection mechanisms could be driven to them. So that kind of, lessons which were done very haphazardly during the pandemic need to be put together into a plan.
Very good.
Can I respond to that?
Sure.
I did hear my name. Sorry, I heard my name a couple of times. So I just want to say that. First of all, I did want to be provocative. I do think data is important, but it's kind of how we think about it, and as Anna said, how we use it. For example, for 100 or 200 years, we've assumed, we in public health and urban planning, that density is bad for infectious disease and for other things in cities. And what we've learned is that it's not density, is not the problem. If it was density, then San Francisco, Shanghai, Mumbai slums and Nairobi slums would have incredible case rates and death rates, and they don't from this pandemic. It's not to say that transmission doesn't happen in close proximity, but it's combined with overcrowding rather than density is the term. So we have data on density, but maybe if we're not measuring what is overcrowding, meaning too many people having to live in one room, lack of access to the basics in a living conditions, then our data are misguided, and they can lead to, I think, poor policy recommendations. And public health and epidemiology has pushed many of those that have damaged those communities that are dense and that are working and that rely on, people said, day labor. So I would take a little issue with my friend Albert that we have to get our handle just on this disease. I would say no. We have to get our handle on this disease in the context of other social vulnerabilities. You said, and we all know that it's things like obesity and other comorbidities that are making certain populations more vulnerable. But what are the drivers of those comorbidities? We need to ask that at the same time. I know you're doing that, but if we only place all the money, emphasis, and policy on the disease that looks like it's in front of us, we miss what's actually been in front of us for too long, like Anna has said, the racism, the discrimination, the segregation, the general inequalities that are leading to the already vulnerable and sadly predicted what we're seeing, as Anna mentioned. So I would say, to me, that's a reflection that it's not just a need for data, because we had some of that data, we have some of that information. It's how we look at it in its context and how it informs decisions.
Very good. We're about running out of time, but I think this last exchange really brings up an important issue, and that is, as you have a pandemic sweeping in, what are the things that need to be done immediately, right? Are those considerations given population and context and environment that's around? And then what are the underlying issues that may not be able to be addressed, certainly not fully, in that acute event? And so it's a bit of a balancing of concerns. It's an opportunity to say, in a post-COVID era in particular, here are the things that we've learned, and this is what we now have a better sense of urgency in moving forward. The physical, social, resource environments, the data systems, can go on and on. But also what we've learned is that if we're going to have short-term, rapid turnaround response, there are other considerations that we better sit down and do for preparedness planning. So I'm in the unfortunate position of having to bring this session to a close. And what I'd like to say is a particular thank you to each and every one of our presenters, Albert Coe, Anna Diaz Rue, Jason Corburn, and Blessing Maburu. I believe now we make forward into a coffee break. And thank you again to the panel, and thank you to the audience. And my apologies to those that might have made an online questionnaire, but we will look at them afterwards and see what we can do about that. Thank you. Back to Karen.
Thank you. Yes, thank you, David. And this is, you set up the rest of the day a high bar, because this has been one of the most provocative, interesting hybrid and successful hybrid panels. So please join us in 15 minutes. Those of you joining us from home or wherever you may be, please return in 15 minutes for our next panel, which will also feature people from afar and from different time zones. So thank you.
Thank you, everyone. Bye.
Take care, Blessing. Bye-bye.
Bye-bye, Blessing.
Bye-bye. Yeah. Oh, yeah. Yeah, that was interesting. Thank you.
Great. You were great. What a great way to begin. That's where we were just starting. We should have just skipped the presentation.
show me how to share that screen? Okay. So you see this is a share screen.
Welcome back, everyone. I hope you had a nice break. We are now on to our second panel, which is focused on the flows of people and investments in and out of cities. And I'd like to introduce the moderator for this panel, Kevin D. Gray. Mr. Gray received his Master of Architecture from the University of Pennsylvania and his MBA from the Yale School of Management. Mr. Gray is a lecturer in real estate at the School of Management here at Yale, as well as at the Yale School of Architecture. He is a former managing director of real estate investment banking for PricewaterhouseCoopers Securities and the editor, along with John White, of shopping centers and other retail properties. He is a licensed real estate appraiser and broker and a registered architect. Mr. Gray is a fellow of the Royal College of Chartered Surveyors and a member of the International Council of Shopping Centers. He has been a lecturer here at Yale since 1999. Please, Mr. Gray.
Thank you very much, Karen. And thank you especially for letting us include commercial real estate in this symposium. It's not the typical kind of real estate conference we usually speak at, but it's an important topic, and our industry is an important industry that has been impacted by the pandemic. But before I introduce our speakers, I would like to maybe make a few remarks about the nature of our industry for those of you who may not be familiar with it. Commercial real estate, you know, we often get a bad rap. We're often the villains in TV shows. In fact, it's hard to remember the last TV show where a real estate developer was the good guy. But it's an important industry that provides where you live, work, and play, basically. Every one of you, whether you rent an apartment in New Haven or shop in a grocery store, order something online, which is delivered from a warehouse, you are part of the real estate industry. So I'd first like to just take a snapshot of where the industry is right now in the context of the last year of the pandemic. Maybe I could show this first slide. This is a slide from Predex. It's based on the NCREIF index. That's a mouthful. That's an index of about 7,000 investment grade buildings in the United States of all property types. And the four main groups of property types are apartment buildings, office buildings, shopping centers, and industrial buildings. So it's important to note that we are talking about commercial real estate in this panel. We're not talking about residential real estate. Our real estate is income producing. I don't know if you can read this. It's a little bit hard to see. But over time, real estate has produced an average return of about 8.5%, mostly due to the income. And you can see that for the last year, ending in December of last year, with most recent NCREIF index data, the appreciation component of our real estate, that's the amount in which the value of the real estate's increased, has declined by about 2.6%. And the income has also declined, but not as much, because the income is due to rents. So let's look at that. These are the two promises of commercial real estate: income and appreciation. When you own the real estate, you collect rent. Where does that income come from? It comes from all of you. It comes from you paying your rent in apartments, you shopping in the shopping center, you ordering products online. You are the source of the income. And where does that income go? It goes to largely institutional investors, including pension funds, such as Yale's TIAA. It goes to insurance companies. It goes to endowments. Yale Endowment, for example, has very large real estate holdings. So the decline in both the income and the appreciation during the pandemic has significant implications for our industry. And those implications go beyond just the investors that benefit from real estate. It also includes the banking system because real estate is approximately 2/3 debt. So the entire banking system in the United States is really underpinned by mortgages and by the repayment of mortgages. The decline in income and also implies a decline in value. And real estate taxes in most of the world are based on value. We call that ad valorem tax rates. And so when values decline, real estate taxes decline, municipalities suffer. Many of those real estate tax revenues are used to support school systems. So there's a really cascading effect that the pandemic had in the short term. So that's my case for the importance of commercial real estate in our lives and how big an industry it is. And then we're going to have our panelists who come from a variety of backgrounds, both domestic and international, discuss from their perspective what has happened during the pandemic to commercial real estate and where we see that going. And I should say that when you look at this NCREIF data, this is not a proxy for what's happened during the pandemic. It's actually real-time data. This is real-time information about declining rents, declining values that are basically reflective of how people are moving into or out of cities, changing how they shop, changing how they live. It's really much more than a proxy. It's really the actual experience. And so our panelists, I'm very pleased to present to you, are very aware of the importance of the pandemic on our business. So first, I'd like to introduce all four of them briefly and then more elaborately later on. We're going to first start off with Bob White. Bob is the founder of Real Capital Analytics and always gives us our data free at Yale for my students. And his real estate research company is the most important research company in the world, really, for the tracking what is being traded, capital flows and sales of property all over the world. He'll be followed by Jody McLean. Jody is CEO of Eden's, one of the largest privately held shopping center developers. But Jody's also been developing mixed-use projects in, for example, Mosaic or Union Market in Washington. Many of you, whether you know it or not, have probably shopped in one of Jody's shopping centers, certainly on the East Coast and as far west as Denver. We're then going to hear from Clint Myers. Clint cut his teeth in research at a number of places, including the Abu Dhabi Investment Authority, the largest owner of commercial real estate in the world, and then Hines Development out of Houston. He now works with Steve Case at Revolution.com on a real estate platform that where he's a partner called The Rise of the Rest. Clint is always looking for values based on where people will be moving in the future. And last, and certainly not least, and she's agreed to stay up late for us, from Hong Kong is Christina Gaw. Christina Gaw's family business, Gaw Capital. I think it's hard to keep track of them. They keep growing. I think they're at $35 billion right now. They're among the top 10 private equity firms. They invest on behalf of many endowments and pension funds with third-party money all over the world, not just in Asia, but in Europe and North America. So with that introduction, shall we start off with, I've asked each of our speakers to just give me one slide, and that's going to be their springboard for discussing the industry. So may I first present Bob White from Real Capital Analytics, coming to us from Fort Lauderdale.
Well, thank you, Kevin. Before you pull up my slide, I just want to reference back to your slide. I think there's some important data in that I want to call out, because this morning I just want to spend a little time talking to you about the capital flows and its reaction to COVID. If it's telling us anything about how we can read the markets, the movements between urban areas and suburban areas and across different property types. But one of the probably the most significant things that people need to understand is that real estate, if you look at that income yield of, pretty much 4% over a 1 year, 3 year, 5 year, 10-year period, is very attractive to any investor in this incredibly low interest rate environment. So even over the past year, a 3.9% yield compared to a 10-year US Treasury of 1.5% or less is a tremendous opportunity. So before COVID, the market was flush with capital and a lot of institutional capital looking at real estate, because as an asset class, real estate's looked very attractive to others. And during COVID, there's actually a tremendous additional capital raise. And this additional capital raise was largely opportunistic. Investors thinking that there was going to be a large price correction in the marketplace and that it was going to be a tremendous buying opportunity. And that largely has not yet occurred and hasn't occurred. Certainly we saw prices, really what we saw the market happen in the marketplace was just a standstill of transactions. So sellers didn't feel like they had to sell at a discount, but buyers were there and they're still there. So let's, move on to my slide, and I'll talk a little bit more about, my subject this morning, which is capital flows, and the slide that I'd like to show you, and if you could pull it up for me, that would be fantastic, concerns liquidity. So this is a liquidity scores that Real Capital Analytics developed, and it basically measures the depth and the breadth of capital in any marketplace. So, it looks at foreign versus domestic, or institutional versus mom and pop type investors, or, public versus private, and, their activity and presence in any marketplace. And I put a select smattering of different markets in there, both global and domestic. And you can see, a couple of things that I just wanted to point out. Certainly the global financial crisis, which really occurred almost as quickly as the onset of COVID, was tremendously more disruptive than what we've seen with COVID. It's also very important to realize, and I think we'll hear more throughout the panel, that the biggest effect has been on the US markets, then probably followed by the European markets. But the major global markets, you can see, have been pretty steady in terms of liquidity. The capital has still been there. The investors did not abandon. The exceptions, and primarily and significantly has been Manhattan, followed by Chicago. I threw Dallas in there, which is in the green, just as a good benchmark for a strong secondary market in the U.S. As a benchmark. Now these are initial reactions. We're still not far enough away. We're just in the early stages of the recovery from COVID, or the rebound. It really is a rebound in investment since COVID, to say if these are lasting effects or not. But that is a pretty significant change in Manhattan, where it went from the most liquid market over the past decade across the global benchmarks to the least liquid. Now, it's certainly, head and shoulders more liquid than, many secondary markets, but I think that is a significant change. It's important to realize that really in the wake of the global financial crisis and the decade that followed that, there was a tremendous migration of investment capital and people into urban global cities. So global cities, which include a number of the major tech markets as well, have been the investment themes over the past decade. So it's density, innovation, and so far we have seen in the US a slight change in the investment pattern of office investors preferring suburban markets over urban markets. Some of that was happening before COVID just because the pricing differential between these global CBDs, urban locations versus suburban locations have become so extreme. But some of it is certainly a possible reaction to COVID and the demand for people to be out in, more spacious areas and open spaces. I also think it's important to look across the different property types because, we often talk about commercial real estate as, one big asset class, which it is. But within that, the different property sectors can perform very differently, and they have been. And COVID has really, heightened some of the trends that we were seeing in the, several years prior to that. So there's been a great, shift in investment patterns and capital, primarily from the retail sector into the industrial sector. And that, of course, is very logical given the, nature of how goods are being delivered these days and online shopping, versus bricks and mortar retail. It's not to say bricks and mortar retail is dead, and I know Jody is going to speak more to us about that, but there's tremendous demand for industrial logistics warehouses, and there's even more now, and that is going to continue, for a couple of reasons. One, because the continuation of the trend, the acceleration of the trend, as when we were all confined home, we had everything delivered to our houses, and some of us found it was actually a lot easier than the shopping that we were doing before. So I think it accelerated the transition to online shopping, and that will stay with us. There's also an issue in the market right now with the disruption in the supply chains. So everyone is warehousing whatever they can get, and they're ordering things sooner than they need it and warehousing it. So the demand for warehouse space is even greater right now. Now that may be just a temporary phenomenon, who knows? But it's incredible when we look at the pricing of these modern distribution warehouse properties, that they're actually being priced on a yield basis similar to trophy office towers in major markets. So these are the new trophy assets in the marketplace. I'll also speak to one other property sector which is slowed tremendously in the wake of COVID is the sale of development sites. So this is a good proxy for what is the future supply of new development coming online. We saw a lot of disruption, a lot of stalled developments during COVID. So developers well behind their timelines on a lot of projects, and they're not willing to start new projects just at this moment or buy land for future projects. They're also experiencing, the same supply chain disruptions that manufacturers and others are. So that is also, wreaking havoc on some of their timelines. So I think that's something that we can expect is a slowdown in development in the future, But the investment capital is there. It is continuing. It's actually, accelerating its charge back into real estate, especially in the U.S. So the U.S. right now is experiencing one of its strongest years in terms of volume. And we believe by the end of the year, it's on track to set a new record amount of transaction activity for the 20-some years that we've been tracking it, which is quite astounding. But it just shows you the attraction of the yield of real estate, the amount of capital that's been raised for property. Europe is also rebounding pretty well. The UK more strongly than the continent. And Asia is a little bit more selective. Of course, China has some other issues that have slowed its transaction activity and sales of land rates. But Australia is on track to have a record year. Singapore is doing fantastic. So the markets are really starting to surpass even prior COVID levels for certain property types and in certain markets. Right now, it's a little too tough to say whether there's going to be favoritism to, suburban versus urban. I will say we're keeping our eye closely on Manhattan. My theory about the global real estate markets, and the commercial real estate is truly a global marketplace, is that, Manhattan and central London, those, relatively few square miles of real estate, are benchmarks for pricing for the rest of the globe. And we're watching them closely. Central London has stayed strong. Manhattan is, flashing some warning signs right now. So those are things that we'll keep our eye on. I'll also add hotels are, have seen the greatest surge of activity this year, but of course, hotels were what really volume collapsed to almost nothing following COVID. And that's primarily a little more of a focus on leisure hotels than business travel. There's certainly a big question mark over the need or the amount of business travel. I certainly don't believe I will be traveling as much as I was previously. There's more things I can handle by Zoom than, the efficiency of or inefficiency of jumping on a plane to be there in person. So there's certainly going to be a big impact on that sector of the marketplace. And with that, Kevin, I'll turn it back over to you, and I'm happy to entertain any questions or.
Thank you, Bob. I'd like to ask if any of our panelists have questions for you. I have a couple, but let me turn it over to see if any of our panelists would like to ask you something about the office market or capital flows. No questions from you? Well, in that case, let me ask you, Bob. You didn't mention the apartment market, which is really booming in New Haven. We've had a number of apartment building sales in downtown New Haven to Singapore investors and others at $350,000, $400,000 a unit. Is there an interplay between apartment and office? You seem to think that your data seems to imply that people will return to working in an office instead of working from home. So my question relates to both office and multifamily and their interaction.
Well, I would say multifamily several years ago, before COVID, eclipsed office as the most active property sector in the US. And its popularity around the globe has been escalating, is probably one of the fastest growing sectors on a global basis. So multifamily, I didn't mention it only because it seems to be more of the same. Although what's really interesting, and if you haven't been to one of the modern Class A apartment complexes recently, the amount of amenities that they have is astounding. And you go through their lobby and it's almost like going to a WeWorks. There is so much space for people to work, there are conference facilities. They are certainly contemplating that people will be spending more time working from home, and not necessarily in their small apartments. The apartments are actually downsized, but the amount of amenities in the space where they can work and spread out, is significant. I just found it astounding. It's, it really does feel like walking into a WeWork when you go into most of these modern apartments.
Can I ask a question, Kevin, about do you see single family home for rent moving into an institutional class? We've got public REITs, and how does that impact multifamily?
Sure, the build for rent or the buy for rent sectors in the US is, been dominated by a few large players, but they're significant. And our clients have been asking about that a lot. I mean, we focus only on commercial, so I'm not an expert in residential. I just know that it is something that's being discussed quite a bit. I think there'll be even more institutional capital going in there. The fact is, I think that moving forward, people want a more mobile lifestyle. And that may be somewhat as a result from COVID. I know that even within my own firm, the amount of, our young employees that moved back home or moved, fairly far away when our offices were shut was tremendous. Many of them have returned, and actually the apartment market in New York is rebounding very quickly. But the fact is the younger generation, whether it's Gen X or younger, doesn't necessarily want to be tied down by owning houses, and home ownership hasn't been something that they've seen as a big wealth generator in their generation. So I think rental has certainly been part of that wave, and COVID's just kind of shown, well, you know what, it's better to be a digital nomad almost than to be tied down by property at that stage in their life.
I think just to clarify for our audience, I think what Jody's question was about was, in fact, the large number of funds now, like Colony Capital, Blackstone, that are buying single-family homes and renting them. So you can move with your family, with your children into a better school district, for example, without actually owning the house. You're just renting it as if you would rent an apartment. And it seems like that is a very popular new idea. So thank you, Bob. If there's one other question I'm going to ask on behalf of Christina, because Christina, your brother Goodwin told me that people in China would never give up going back into the office, that it was just not the culture. You had to go to the office. And I'd like to ask Bob if he sees anything about that in the data comparing, Manhattan to Shanghai, for example, in transactions, or in terms of the way in which people around the world will consider how they use office space. Will Americans just refuse to go back to the office 5 days a week, whereas the Chinese want to and insist upon it? I'd like to have your opinion about that. And of course, when we get to Christina, I want her to circle back on that later on. Thank you.
Oh, I think that absolutely. There's a big cultural aspect, especially in Asia, but also throughout Europe, of being in the office, in the FaceTime, that's part of it. There's another factor, which people don't talk about as much, is that, the apartments and the houses in Europe and in Asia are much smaller than they are in the US or Canada. So, working from home not that pleasant, or isn't as nice as, the options that many people have in the US. So, that's another reason that, people aren't talking about working from home on a permanent basis, or in a significant way in Europe and in Asia, as much as they are in the US, where we have much larger homes that can go. I know the people in my firm that came back to the office were the ones that were in small apartments with little kids, and they couldn't wait to get back.
Yeah, I think generally that's exactly it. It's that it's not just China, but generally in Asia, all the key cities have very small apartments. So it is not common at all to have prolonged work from home. It is very disruptive. And so that's actually the primary reason as to why we do not believe commercial assets would be, would be out of favor. Yeah.
Okay, thank you very much for that. Now I'd like to turn over to my next guest, Jody McLean. I don't know where to begin describing Jody. She's really a visionary. I wouldn't even classify Jody as a real estate developer, but rather as a placemaker, a person that makes very enriched properties. I think one of her signature properties, Mosaic District in Northern Virginia, if you've been there, with the Angelica movie theater, is just a beautiful property. And Jody's industry, which is retail, is, as Bob mentioned, much maligned these days based on the growth in Amazon, for example. But I'd like to introduce Jody McLean, who's the CEO of Eden's, premier shopping center owner and developer in the United States, coming to us from Washington, D.C. Thank you, Jody.
Thank you, Kevin. Thank you for having me. You're a little bit too kind. And it is great, at least on the screen, to see so many old friends. I would just start, Bob, by telling you, you're right, we're not dead yet. Retail is very much alive and thriving in really a brick and mortar as well as a digital All COVID did was really accelerate that combination of the two. As of today, this is how we track, I guess this is about a week old data. We track our footfall to 2 years, to where we were in 2019. I think this chart does a great job in showing what happened, but we're at 109% footfall to where we were this time 2 years ago in 19. So, and we're seeing this now throughout the whole country. And if you overlay what's happening at Eden Centers with the market more broadly, we're really, everybody's right there on top of each other. We're seeing these trends pretty consistently. We saw a little bit of a drop off where you had the high spike in the Delta variant of COVID, but you're back now at about 109%. As we look forward to holiday, and this again is all domestic, as we look forward to holiday, there's anticipation that our holiday sales will be up 7 to 9%. But there are headwinds. There were going into COVID, obviously. I think COVID helped accelerate some of that. But the number one thing, we're going to continue to see retail rationalization. Going into COVID, we had about 23.5 square feet per capita of retail in this country. I believe that we're going to settle out around 18 square feet per capita. I would have told you this will take 10 years to get to, just because of lease encumbrances, debt encumbrances, but we saw this accelerate a good bit during COVID with the shedding of a lot of bankruptcies, a lot of leases, and we saw a lot of debt right sizing. 60% though of that rationalization is going to happen in lower tier malls, so indoor malls. Doesn't mean that the open air, that's the space where Eden's is at. It doesn't mean that we'll be immune to this rationalization. We're just not going to see it quite as strongly. What it does mean though is the retail, physical retail left behind will be stronger than ever. And I'll go through why, try to go through this logically. The other thing though, the other headwind we are going to see is you're going to see fewer major store openings. 2015, we would have seen 5,000 store openings by major brands. Now it'll be somewhere around 3,000, 3,500, but these stores are going to be really impactful because as you've seen e-commerce, and we'll talk about the growth of e-commerce and the physical grow together. The physical store is still squarely in the middle of almost every single brand's business plan. Why? Consumer acquisition first and foremost, loyalty and conversion. So without the store, it's very hard to have the conversion onto e-commerce. One of the fastest growing brick and mortar retailers right now is Amazon themselves, trying to get directly into the customer and trying to also solve for that last mile issue. The other thing that we're going to see is we're going to see a lot of store openings from what we refer to as digitally native brands. So brands that launch online, but find that they can't find their growth that they need to find without coming to the physical, without coming right to the customer acquisition. But those digitally native brands are going to need fewer new stores. So instead of having these mega brands that have 1,000, 1,800, 600 stores, you're going to see a lot more brands that probably have 10 stores and really targeted places. But as you watch the IPOs, we just saw this with Allbirds. You've seen the history of Warby Parker. All of these companies, as they go to raise more capital, it's all about store growth. And when they open new stores, typically they'll see a bump in their e-commerce in that trade area, somewhere between 20 and 35%. So the store's still right dab smack in the middle. E-commerce is going to continue to grow. No physical retail person will tell you or back off from that. E-commerce is not our foe, it is our friend, it is our partner. I don't think brands can, large-scale brands can be successful without meeting the customer. And much like at work, it is our talent, is it sort of in charge of where we go. Now it's the customer is totally in charge of where they want to transact. So if they want to transact in the physical, if they want to transact in the digital, it has to be seamless, and you have to offer both. So we're going to continue to see e-commerce grow. We saw it absolutely spike during the pandemic, especially during the lockdown, and you saw it drop right back down. We're at about, we'll probably end this year somewhere around 22%. I think that'll continue to grow and probably level out somewhere around 25% over the next 36 months. But as we talk about e-commerce, one of the most important things to remember is that at least 50% of all e-commerce growth is driven by something we refer to as BOPIS, buy online, pick up in store. So most brands are considering that as being e-commerce. But what you're ordering online, you're going to pick up in the store. That store again remains at the center. So we have to really think about that hyper convenience and what's happening in BOPIS. About 90% of everything we own is grocery anchored. We love the grocer. I'm going to talk about that in a minute in driving trips and dwell time. But you've seen BOPIS grow really in every single sector, but you've seen it grow exponentially in grocery. But that meant from 0.5% of grocery sales to about 2% are now driven online. So huge growth, but really not that large of a total percentage of the pie, but we're going to continue to see that growth. We saw 130% last year. Coming in to 2021, 90% of all major brands said that they're going to offer BOPIS in open air. Again, where we are, BOPIS is staying. In the malls, they've seen it pull back just a little bit, and that's only because of a convenience factor. But it is really a huge part as brands think about solving last mile issues, delivery issues, and a huge convenience to the consumer who wants to be in control of what time they can go and they can pick up. So we're going to continue to see that stay. Community. This probably is the single biggest factor in retail. And as I often listen to the other commercial sectors, everybody's talking about community now. We've been talking about it forever. There is an overwhelming desire for community in this country. Otherwise stated, loneliness continues to be a rapid epidemic in this country. 72% of Americans report that they're happier when they're connected physically to a community, when they feel like they have friends, they have real life social interactions with their neighbors. This is the #1 determinant of happiness in most people's lives. Yet going into COVID, only 31% of Americans actually knew their neighbors, knew who their neighbors were. 2/3 of millennials don't feel like they belong to their local community, and 79% of Gen Z report routine loneliness. So that means that the work that we're doing, focusing on 3.5 trips per week, 5 hours of dwell time, huge numbers if you think about it, is some of the most important work we can do. Because when people come together, that routinely they're coming to places that are convenient to them, but they're also coming to places that have their essential needs, but are fulfilling their emotional needs of connection. They start to recognize other people. We see this all the time in our data. They start to dwell a little bit longer. And that's when prosperity happens. That's when We see it happening economically. We see it happening socially, culturally, and soulfully. And this need for community has shifted radically over the last couple of decades, away from places it was traditionally happening, whether that was in local parks or in churches, and moving into the shopping centers, to retail places. So we have to think about being much more, we used to be able to, prior to COVID, we were placemakers. And I would say coming out of COVID, we've really had to think about being experience makers. The people need more than just a place, and need an experience that will offer that engagement. 17 minutes, you've heard a lot about the 15-minute city. I'm sure the mayor of Paris has really hit the headlines with this, but 17 minutes here domestically in the US is real. You saw the shift to hyperlocalization. It's not going away. First and foremost, driven by convenience and driven by a need for community, and safety is fueling this hyper-localization. 94% of all consumers in this country will not travel more than 17 minutes. So that's whether they're coming by mass transit, by foot, by car. They won't travel more than 17 minutes for their everyday purchases. It's both a physical barrier and an emotional barrier as they think about connection to community. So that is driving a lot of where retail is located, what's going to make it most successful. 80% of all US disposable income is spent within 20 miles of a person's home. And these same sort of physical barriers we see run very consistently, not only in physical space, but online sales as well. So we saw that during the pandemic. Shopify came out with early on with a really great data, and surprising that even in the digital space, people were buying close to home within their community. It was a connection. The other thing we saw shift during COVID was that 70% of consumers changed their shopping behavior, really looking for essential needs. And we have post-COVID seen a huge uptick in luxury and luxury sales as well. I think a lot of that being driven by pent-up demand, as well as some of the stimulus has shifted surprisingly more towards luxury than essentials. But what people are telling us is 60% of the people are saying, wait, I'm staying with essentials. My shifting my shopping patterns have shifted to essentials. I'm focused, and that we expect this trend on essentials to last really for several years post-pandemic. And the final thing I will say, and you've heard me refer to this a little bit, is emotional wants. 73% of consumers point to experience as an important factor in purchasing decisions. 86% of consumers are willing to pay more for their goods to have a great emotional experience in the places they're in. They want to be connected. They want to know people. They want to have a conversation. They want to learn content. And just about a third of every customer who's showing up in a store is really showing up for social experience. So as I said earlier, the focus here on Edens is figuring out how we really move from being just placemakers to being experience makers that are really emotionally tied. But I would say brick and mortar retail, and we've seen this, Bob, too, and I'm sure you've seen it in your data, the capital flow back into retail, the pendulum swung really very quickly over the last 60 to 90 days. Some of that driven by lack of yield in multifamily and industrial back to retail. And some of that, especially open air retail, grocery anchored retail, and some of that being the coming out of the pandemic, going through the pandemic, people have realized this is a really core asset, not only in their portfolios, but in people's everyday lives and bringing community together.
Thank you so much, Jody. And I've got to tell you, anyone who's down in Washington should go to the Union Market near the Union Station in the US Capitol, just to see the magic that Edens has really wrought. It's just a really beautiful, beautiful project in development. I have one question, Jody, before we move on to Clint, which is with men, you know, traditionally the men go to work. You know, I live in Darien, Connecticut. The men all rode down the train to Wall Street and the women stayed home, and the women were 95% of all the shopping. If the men are going to stay home 3 days a week or whatever and not go into the office, do you see a difference in the way that your centers are going to operate for men versus women?
No. What we're still seeing is 80% of all retail decisions, regardless of who's showing up at the cash register, are still being driven by women. There is typically a mother, daughter, wife, girlfriend, somebody sort of behind there. And that's one thing that has sort of remained consistent. We are really thinking, though, more than I would say female or male, we're thinking about the family as a unit, and how do we make our places comfortable, no matter who is there, but thinking about the whole family and generationally. Those are the places that seem to have the most stickiness, so to speak, for the consumer coming back over and over again, whether he's showing up with his wife on date night, he's showing up with the kids, it really, we need to meet that whole cycle. But I would say, much like I think about my boys, my boys, when they first get their apartment, had no idea that they needed an end table or coffee table. They just needed a chair and a TV. And as soon as she shows up in their life, all of a sudden they need a beautiful lamp and they need the coffee table and the end table. And they're really so much happier in their apartments. They just don't know why. And I think that's how we think about our places.
Okay, well, that certainly describes my kids and my wife. I get told what to go buy.
There you go.
I'd now like to introduce Clint Myers. Clint cut his teeth at the Abu Dhabi Investment Authority and research. He morphed from a researcher to a real portfolio manager. While at Hines Development in Houston, I think Clint was responsible for Hines going into student housing in the UK and worldwide, and also helped them set up a Main Street fund with the Bavarian pension plan, where they buy things like they bought the, what is it, the Hard Rock Cafe in Oslo and all of that, Main Street properties, because Clint is really a futurist. And now he's doing his futurism for Steve Case at the Rise of the Rest. So Clint, take it away.
Thanks, Kevin. I've got a slide as well, if we can raise it on that side. Hey, Jody, that last comment really resonates with me as well. I think even at my age, if I had my druthers, I would have a table and a chair. And my wife does buy sometimes, I think, too much of the stuff. But I think you're right how that works. You know, to follow up on Jody, what I took from your talk, what really resonates with me is the idea that technology, which is often thought as something that pulls us apart, can actually pull us together. So if you think about that train, which was technology brings this hyper-localization because we don't have to drive an hour to the mall to get stuff, right? We can order on Amazon. So we've got that hyper-localization, which brings this community, which is kind of an interesting way to get there. And we have something of a similar view. So before I go into my slides, I want to sort of pull back a little bit and talk a little bit about two big themes that impact our view of the world. So the first theme is, over the past, say, 30 to 40 years, you've had a rise of superstar cities. And I'm mostly talking about the United States. So a small number of cities have really gotten stronger and stronger and smarter because there's these agglomeration effects from being together. And a city is a platform. So the more companies and the more smart people, they're going to draw more companies and they're going to draw more smart people. And that's the virtuous cycle that New York and San Francisco and Boston and a few others had been on, really starting in, say, the early 90s, so the past 30 years, as we became more and more of a knowledge economy. But what happened through that rise of superstar cities is those cities got more and more expensive and more congested and more challenging places in which to live and to raise a family. So that's one big theme, is this rise of superstar cities. The other, which is sort of a centralizing force into a small number of areas. The other force is the internet. So the internet is very much a decentralizing force in that it allows you to do things from anywhere, make friends, play games, listen to music, etc. So at some point, these two forces had to collide. And the question then is what happens when they collide? So Kevin mentioned earlier, my boss is Steve Case. And Steve, some of you may remember, started AOL back in actually the 80s, surprisingly. And he was really one of the big forces to get Americans on the internet. And he had a vision that people would be online, and finally we all are there. And so our thesis is that the internet effect is stronger than the superstar cities effect, essentially. That this decentralization brought on by the internet is stronger than the agglomeration forces brought on by superstar cities, creative class, et cetera. And that in the future, and really accelerated by the pandemic, people are going to have more and more choice as to where they live because they can do their jobs more flexibly. So this Rise the Rest thesis was created 5 or 6 years ago. And the pandemic, of course, has accelerated it. But we think that's where the direction was going anyhow. And so now, if you look in real estate, it's really going crazy. If you look at home prices and apartments, so residential, because you're getting really all at once these changing preferences, but overlaid with that, you've got an industry which is very slow to bring new supply, just because it's hard. It's hard to build new things. It takes a lot of time and capital to do it. So rents and home prices, essentially regardless of where you live, are up more than 10% over the past year, which is crazy a year and a half after the pandemic. And I never would have guessed that. Even if I really were a good futurist, I wouldn't have nabbed that. So I want to pivot that a little bit to thinking through what we do and tie it a little bit to real estate for us. So this left-hand graph, I kind of cheated and put 2 graphs on a slide. We were allowed 1 slide. So the left-hand graph is a comparison. Every dot is a city. And so it's showing what it costs to rent an apartment unit for a month on the vertical axis. And then the x-axis is how much venture capital gets invested there annually. And you can see this upward sloping graph, which points to that first comment I made around the knowledge workers, the superstar cities, the agglomeration effects. Right? The more and more entrepreneurial activity, the more startup activity, the more wealth, the higher the rents are. So we believe that as an investment thesis, at least, the places that become more and more entrepreneurial, that draw more startups and more venture capitalists, that's where rents are going to grow in the future. Now, is that good? You don't know. It depends on who you are. It's not a good thing overall for cities to have their rents go up, but for investors, for the large institutions of real money, like Kevin mentioned in the beginning, it is a good thing, and it's ultimately what you're looking for. So our funds, we've got 3 different venture funds. They invest in a number of these cities. And so the graph on the right is showing, here's how much venture capital has been invested over the past 2 years on average during, say, pandemic period, compared to their normal. So up at the top, those are the cities that are seeing much more venture than they normally would have. We use this not exclusively, but as a leading indicator to figure out, okay, what places are starting to get more entrepreneurial? where are people going to start new companies that 10 years ago, they would have had to go to San Francisco? Because that's ultimately how it used to be, is if you wanted to get funded, you had to go to where the venture capitalists were, which is mostly Boston, San Francisco, and New York. Those three places account for roughly 75% of all venture. But now, with the internet, with the ability to do these Zoom calls, you can be in Detroit, Philadelphia, Louisville, Columbus, these places that are more under the radar, but way more cost effective if you're trying to start a company, and you can raise money from there. So we expect some of those, not all of those, over the next 10 to 20 years to be the next big startup centers in the United States. And they're not going to overtake New York, and they're not going to overtake Boston, but they're going to close the gap. And we think that's a good thing, not just for investors, but for society, because it's not a healthy structure in my mind to have 5 cities that are doing great, and then the rest of the country is doing poorly. And I think we're going towards a place where a lot of these cities on the right are going to do a lot better in the future. And maybe the Bay Area, I think specifically the Bay Area, is going to do worse. Which ties into one more point as we think about what the pandemic has done to which cities we think will do well. You know, it used to be the case back in the, say, 50s and 60s, that you could have places like Rochester, New York, which was the home to Kodak and others, or Armonk, New York, which is the home to IBM. Those places could do well because you had that one big employer. That doesn't work anymore. And now cities have to compete on their own to draw people. And so mayors are kind of more like CEOs in that they always need to be recruiting. And it'll be interesting to see the cities that really thrive coming out of this, I think, are the ones that are going to understand that strategy, and also the places that are fun. So if you've got more flexibility to choose where you want to live, it makes sense, at least to me, that the places are going to benefit are the places that you choose to do. You choose to go there. And I sort of have a quick heuristic of, all right, if somebody says, is this place going to do well in the future? You could ask, well, would you go there with your friends for a long weekend? Would you go there for a bachelor party or bachelorette party? Because those are the types of places that are really doing well. Like Charleston's doing great. Nashville's doing great. Austin's doing great. These are places that you would go with your significant other for a long weekend, or your friends. And those are the types of places that ultimately we think are going to do really well. So yeah, maybe I'll pause there because I know we've got another speaker in probably only 15 minutes to see if there's any questions.
Okay, Clint, and I got to remind myself and you that the first time I heard about you, a mutual friend of ours said to me, he likes Columbus. That was your brand. And the pandemic, in a curious way, has actually been the wind behind your back in a way, even though it's a catastrophe. It has certainly validated a lot of what your investment thesis was, or accelerated it. I think that we'll circle back for questions about that excellent presentation, but I'd like to move on to Christina for the next 10 minutes. Christina stayed up from Hong Kong for us, and Gaw Capital is really our, Christina, you have a heavy burden of representing the entire globe, because I know Gaw Capital's in Los Angeles and Madrid and Milan, Berlin, London, all over Asia, China, Singapore, and in so many different property types. I know Goodwin just bought, he told me you bought shopping centers in Hong Kong and apartment buildings in Nashville. So I'd like your take on the pandemic and how that's, how you look at your business since the pandemic.
Right, thank you, Kevin, and thank you for the panelists. I think throughout your talk, I also was taking down some notes because there are similar thinking where we do things in Asia as well. I'm going to spend, of course, my talk on Asia Pacific because I think we have got a lot of expertise talking about the US already. We could get to the page that has the actual slide. Yeah, thank you very much. So I would say that, you know, even though right now I'm in Hong Kong, but as Kevin, you mentioned earlier at the start, I just got out of a 21 days hotel quarantine in Hong Kong just last week. And prior to that, I have been spending 3.5 months overseas in the US as well as Europe, London as well. So I have been away for quite some time. And what I've realized is that because Asia has somewhat the way that we have managed COVID was quite different to the Western country in that during the shutdown days, domestically, we actually are operating quite normally most of the time. But in terms of shutting down travel, we have been doing to this point, continue to be much more severe than anywhere else in the West. That's basically the gist of it. And I think that we are going to continue to see that going into next year, at least for China and Hong Kong. So because of this strict restriction, actually domestic activities have actually still been quite vibrant for the past year. If you look at China, China as a whole have already opened up on its own domestically since the May of last year. So the domestic economy itself has actually been doing well because the citizens actually cannot travel. So they are basically consuming domestically in quite a robust manner. And so basically, if I look at the real estate trends post-pandemic, I have shared on this slide a couple of major sectors that we have been very focused in and is actually developed very, very well. So in terms of the IDC sector, it is quite a mature sector in the West already and a very successful sector. But out in Asia, it's actually still quite new for us. But the great thing is we were able to pick up the best technology and be able to kind of do ground up builds to facilitate a lot of the best hyperscalers around the world, as well as in our region. So clearly the exponential demand for IDC sector is actually triggered by the rapid increase, continued increase in e-commerce, the proliferation of consumer tech and connectivity, as well as a very, very strong 5G migration, especially from China domestic perspective. So therefore, there is exponential demand need for data center. And so we have been very rapidly growing that in China, as well as the rest of the Asia country. And then if you look on the right-hand side, then offices. I know that I have to kind of revert back to look at this sector. And as I mentioned briefly, is that because Asia, the key cities like Hong Kong, Singapore, Taiwan, Korea, you name it, these are all the key cities, homes are actually small. There are very, very few very large homes. Basically, to give you context, in Hong Kong, there is only 0.3% of the entire residential stock. It's larger than 3,000 square feet. Okay, 0.3%. So you could imagine, basically, majority of the homes are way below that, and of course the mass market is probably more around the 1,000 and sub 1,000 square feet space. So therefore, offices is definitely continue to be much needed. And in fact, because during COVID, there's a lot of disruption, people cannot travel. And obviously in Hong Kong, for example, we have also gone through riots before the pandemic that started in 2019. So that has actually caused commercial prices to actually come off and allow us to have very good buying opportunity in terms of value. So we were able to participate quite strongly in the Hong Kong commercial sector. Vietnam was also a market that we like a lot because it is a key beneficiary of the sort of China moving the low-cost manufacturing labor over to Vietnam for exporting purposes when the US and China trade war broke out. And then Singapore is also in the recent 18 months, definitely getting a lot of the global multinational companies market share as an international city for Asia, because Hong Kong is more and more becoming more of a key city for China, one of the key cities for China. And so a lot of the multinational companies movement in terms of headquarters in Asia is going to Singapore. So there is also showing an increased need of commercial space as well. Life science parks. Now, again, this is actually a very successful sector within real estate in the United States and Europe as well. Boston is, for example, is very, very successful in terms of medical real estate. And we're definitely seeing the need and demand for the China market with this 1.4 billion population. And that as the affluent wealth growth comes about, then people's focus on well-being, it's increasing as well. So there is a significant need to develop the life science industry in China. And therefore there is increasing need for the real estate complementing those labs and, research labs and so forth. And then, moving on to retail. And I think when Jody was talking about her area of expertise, I was kind of nodding my head a lot because in a way, while retail as a sector was in the last, I would say even 5 years, was getting a lot of people being very skeptical globally in my investor base. But I oftentimes always try to emphasize that there are a lot of different retail sector within that whole industry. So in terms of outlet malls, it kind of, for us, it kind of represents like an experiential retail. And we have actually done very successful in terms of the outlet mall platform in China that we started in 2011. And we have established outlet mall concepts that is very European style. It builds like a Florentian village type of feel, and it has a lot of entertainment, F&B, obviously with the brand name stores selling at discount prices as well. And this is actually a very, very highly sought after entertainment on the weekends for families. And despite, especially during COVID, we have actually seen the business growth to be extremely strong at the 25-28% year on year because of, especially when the population cannot even travel. So the business was in fact, much more sustainable than any kind of luxury retail. And then in terms of non-discretionary retail, that's another segment within retail that I think, Kevin, is what you mentioned about Goodwin mentioning that we have just bought, a very big retail platform through 2017 and 2018 in Hong Kong, which are these 29 non-discretionary retail mall that are linked to thousands and thousands of mass public housing units. So these are malls that are connected to underground rail, bus stop, taxi stands, and bus station as well. So in a way, these are basically community malls where 80% are F&B related. And then another kind of 10 to 15% are kind of pharmacy related fast food chain, type of malls. So during COVID and even during the Hong Kong riots, we are seeing business increase exponentially because people were staying more within their home vicinity in terms of their spending. And also, BOPIS, what Jody was mentioning, which we don't have that term in Asia, but now that I've learned something new, there are basically online platform operator opening a big store, like an experiential store in these neighborhood mall to be sort of like a last mile logistic delivery stop. And so in that, they sell a lot of the big electronic items online. But they would have this big store in our neighborhood mall, like non-discretionary retail malls, to allow the people to go and pick up their goods. And in the meantime, they also place a lot of other complementary, smaller goods item around those stores. So ended up, the customer would actually consume more. So this is also something that we have seen, that are finding location in more of the outskirt area, not in the prime location. And it's actually benefiting tenancy in these type of malls that we own in Hong Kong. And of course, last but not least is logistic platform, where because of the very, very strong e-commerce growth, we have been seeing huge logistic demand. And in China, we have developed a very, very strong platform since 2014. And then we are also now developing into the Asia Pacific area. And within logistics, we are also going into more of the cold storage, which is a subsegment which offers a higher margin. And I think, some of these sectors in the West, it's already doing well. So in a way, we are adopting quite a lot of those successful strategies that we have seen that worked in the West. And basically, when we bring some of these ideas back to Asia, we were able to identify the right kind of operator to work with, and sometimes also work with operators that are successful in the West. And when they might wanted to move to Asia or expand in Asia, we would kind of become their real estate partner. For example, the outlet mall was the case, where we ended up was JVing with the second largest European outlet mall operator. And but we are the one that is providing the on-the-ground intel in terms of how to get land from the government and how to do the build out, whereas the operating partner from Europe would actually bring in all the brands. So that has been, a lot of these platforms built that allow us to actually build the business in a much more scalable manner. So I think that these are sort of the sectors and the region where we felt would get quite a lot of good vibes in terms of post-pandemic world in our region. Yeah, so I'm going to stop there and pass it back to you, Kevin.
Okay, thank you, Christina. Thank you very much. I was on a panel in Hong Kong some years ago, and the panelists were asked what would they do differently now, 10 years, after the global financial crisis. And the others all said, I wish I'd given my money to Gall Capital. So, you have quite a successful record. So with that in mind, I know that among your many other jobs at GAW, you're in charge of investor relations, I think, aren't you?
Yes, I'm responsible for all the fundraising for GAW.
In addition to capital markets. And I'd like to know, after the pandemic, what were the questions you were getting from your investors? Were they panicking? Were they worried about real estate? What were their top three concerns when they would call you on?
Well, I think in the last 6 months, it was very, very obvious was about the China regulatory concerns. In that, it was actually really good that I was actually out there and traveling and doing marketing in person during the summer. I was, as mentioned earlier, I was in the US, I was in Europe, as well as London. And I would say all the meetings, probably 90% of the time, was talking about the China regulatory concern. And even up to now, we are still dealing with a different kind of regulatory concern on, the developers, right? Whereas in the summer, we were dealing with all the anti-monopoly, as well as the tutorial sector, and so forth. So I think, I just had to really explain to them what is actually happening in China, and also how the government look at things as a whole, because operating for 16 plus years in the China real estate sector, every 3 to 4 years, we have seen these sort of regulatory reform, that is happening. And a lot of times it's actually being done at a time where the economy is doing fairly well, and the population is generally happy. And to a certain extent, sometimes the sector is going a little bit in an exuberance manner. And that is when, the government would try to come in and put in certain regulation, because it is time to sort of do some consolidation, so that it could achieve or allow a more sustainable growth. So we also try to share with investors that being on the ground versus when I was traveling, I was also listening to all the news. When I was traveling in the West, it is actually quite biased as well. So I try to put a neutral view to things. My husband is American. So in my household, it is a very, very even discussion. Nobody is actually biased on either way. It was just a very healthy discussion of what exactly is going on in a factual way, right? So I think being able to be in the US and being able to face investor face to face and be able to tell them exactly what's happening in our world was much more comforting. Instead of, they used to be able to travel. These are, my LPs are international themselves. They have been supportive LP of ours. They used to travel out themselves, so they could see for themselves what's going on. And so it was a lot easier for them when they would go back and talk to their investment committee as to, certain things are not exactly true, where they listen to the news and whatnot in the West. But because these 2 years, they cannot travel over because of all the stringent quarantine requirement out here in Asia. For us being able to go there and tell them what exactly is happening was very encouraging. So I would say that we are currently in the market raising our flagship fund 7. And so far, knock on wood, we have done quite well, despite that there's all these news flow coming out from China. Yeah.
So it seems like the pandemic hasn't really Uh, did it slow down your business, or it had no effect whatsoever?
Well, well, there's definitely effect. I would say that, I would say that leasing definitely has slowed during the time where it was in the crust of it last year. But I would say that for the past 12 months, within the China market itself, because even though they have shut off traveling to the outside world, but domestically, it's all open. Basically, domestic traveling was all open. People don't even need to wear masks. So the thing is, because we have local presence in 11 countries in Asia, so ended up we were still able to transact well. So, but I would say yes, Kevin, in terms of office leasing, probably as a sector, has definitely experienced the slowest growth, because people were not willing to bet on increasing in space use and whatnot until kind of COVID situation improves, right? So so from that standpoint, I think we are definitely affected, but it's definitely not detrimental. I think the sector that has been affected the most globally, as with everybody else, is definitely hotels. And I think I agree with one of the speaker earlier as well, that leisure travel has seen rapid improvement, but some of the business hotels, we also believe that it will actually come out from the pandemic in a slower recovery way. We do have about 17% of the portfolio in hotels. Yeah, so we are kind of getting through them, yeah.
Yes, well, thank you. Yes, I know that Goodwin and you started with the Roosevelt Hotel in Los Angeles and moved on from there. I'd like to, in the 10 minutes remaining, circle back to our speakers to engage them in a conversation. I'd like to start with Bob, because Bob, you said that you felt that capitalization rates, pricing was all based on what's happening in London and New York. That seems to contradict a little bit what Clint is saying in terms of the growth of the secondary markets where young people want to have fun. Could you comment on that, please?
Sure. I think I probably didn't get it across. I think that historically, Midtown Manhattan and Central London have been the benchmarks for pricing. And I think that that's changing as, certainly you see Manhattan is diverging quite substantially from other global markets right now in pricing, and, they haven't followed. Brexit has kind of disrupted, London's appeal. So I think that, I agree with Clint. It's secondary markets. I think there are, more cities in Asia that are, entering into the relative pricing scheme. Historically speaking, those are the two markets to look to for, where prices are going. And whether or not that's going to continue to be so, is a little bit more in question. I think that, their positions are certainly, have dropped from being, it was at one point 10 years ago, nearly a quarter to a third of all investment volumes were in New York City or London. And that's no longer the case with the rise of secondary cities and the growth of the Asian markets. So that it's certainly changed.
Do you remember, Bob, when you did a case study for me at the School of Management, and we gave our students a choice of where to invest, and I think only the student from France wanted to invest in New York City. Everybody else wanted Raleigh. So that's the next generation. I guess they live in the house of the future. I would not discount New York City that quickly, and I would think that Raleigh was a rather thin market, but we shall see. So I would like to go back to each of you individually and ask you to tell me what you think is the most important effect of the pandemic on the business as you see it. So why don't we start with Bob?
I think the longest lasting effect that's an easy call is going to be a substantial hit to business travel. There won't be nearly as much as there was before. I think people are fundamentally social beings. I think conferences will still be there, but just traveling across the country just to attend one meeting is probably going to be far less of that going forward. So I would say business class hotels will probably have the longest lasting impact from COVID.
Well, I'm hoping to see Jody at the ICSC in Las Vegas in December and be invited to her company party, as I usually am. So Jody, I'll turn it over to you. What do you see as the most important lasting effect of the pandemic?
Well, Kevin, you are definitely see me in Vegas. As long as you're vaccinated, you will see me there. That's the rule for ICSC. And you're reminding me about our cocktail party, so I'll make sure that you're on that invite list. I think for us, it really goes back to the lasting effect is going to be more emotional, I think, than physical, because I think what we've seen is an acceleration of trends. We were headed towards this digital world, if you would, where the physical and the digital become one. And I think retail, it just accelerated us to being there. There's no question. It's accelerated a lot of the BOPIS that we knew was coming and a lot of the e-commerce. So these technology trends, more than anything, were accelerated, and I don't see them changing. But I think this acute awareness for the deep desire of community and people really feeling that. And I don't see people moving back off of that. They're not going to give up lifestyle. I don't think being a part of it, embedded into a community, is important. And I think that you will see people relocating to places they want to be. For us, the suburbs have been on fire. I think that continues as long as there's this urban sensibility. And I think that's important too, this urban sensibility that people are looking for. But I think it's this deep attachment to community and really thinking long and hard about what that community looks like and where they're going to be. And I don't think that just, and I don't think that means people clear out in New York City either. I'm with you. I'll never bet against New York, but I do think it means slowing down and really investing the time in the physical manifestation to be a part of community.
Okay, thank you very much. Eloquently stated. Next, Clint. How about you, Clint?
Yeah, I think that I see less friction. So real estate and how we interact with cities is getting more and more flexible and fluid. For instance, I'm at this WeWork that I just came for the day, right? And this wasn't the case 10 years ago. And so I think given more choice and more mobility and not being tied down by a single job in a single place for 5 days a week between 9 and 5, opens up a world of options on how you spend your time. And I can see it manifesting itself already in apartments where we've spent a bunch of time, and folks looking for something beyond just a single year lease, which has traditionally been the offer. Like real estate has evolved along these guidelines. Apartments have a 1-year lease, offices have a 10-year lease, and all these things that if you actually look at it through a post-pandemic eyes, you kind of go, why? Why is that the case? Like, why aren't apartments furnished in the United States? These things that, if you incorporate them into your places, allow for a much more flexible life, whether that's work, fun, school, all these different things. I think things are just going to become more fluid, and real estate has to adapt to that, which is challenging.
Okay, thank you. Well, we still want to buy our furniture at Jody's shopping center, so let me move on to Christina now for the final thoughts about the lasting, lingering effects of the pandemic on global real estate.
Right. So we're definitely seeing a lot more people buying holiday homes in resort destination, more than ever before. And it does seems like people have a view that these type of work from home or other type of pandemic because of climate change, it could hit us, more frequently than anything in the past. And so therefore liquidity is still very good globally. So we definitely felt that the sort of holiday homes in resort destination, it's an interesting sector that is a sort of lasting effect coming from the pandemic. And linking to that is also, even though we did not talk about ESG in this particular panel, but it is a sector that is extremely connected to real estate, as we all agree. So I do believe that, you know, over the next 10 years, we're going to have a lot of related technology or prop tech, or, you know, with private equity and real estate kind of merging together because of the sort of the ESG focus, you know, which is, again, it's something that I think all of us in the real estate sector would continue to be very focused in getting into that space. Yeah.
Yes, and I think you have one of my former students working for you on your private capital venture where you are investing
that's right.
Where you are investing in startups. So I think that wraps it up for us. I'm getting a nod that we're out of time. I can't thank you all enough, and I've got to tell you how much I miss seeing you here at Yale. And I long for the day when you can come back and we can all, you know, it's so important in real estate to go out drinking with each other and to party, because there aren't enough lawyers in the world to create that kind of trust. So I really miss all of you, and I want to thank you all for joining us from Hong Kong and Florida and Washington and Boston. Thank you very much.
Thank you.
Thank you, Kevin.
Well, thank you, Kevin. And that was a really, really interesting panel, and you know, just to show that real estate is here to stay and cities are here to stay. So that was quite positive as well. So for those of you joining us live or from your home, we're closing this session for the next hour. We're going to take a lunch break, and please rejoin us at 1:15 Eastern for our third and final panel. And then we will have a closing speaker talk about disease ecology in cities. So see you in about an hour. Thank you. Okay, everyone, welcome back, especially those of you joining us online. Welcome back to our third and final panel of the day. Our panel now is going to focus on parks, mental health, and the pandemic. And the panel will be moderated by Dr. Morgan Grove. Dr. Grove is a social scientist and team leader for the USDA Forest Service's Baltimore Urban Field Station. He's also a lecturer at Yale University here at the School of the Environment. He joined the USDA Forest Service in 1996 and has been a co-principal investigator in the Baltimore Ecosystem Study since its beginning in 1997. Dr. Grove is a 3-time Yale graduate. Not many people can say that. He has a bachelor's degree from Yale College with a dual degree in architecture and environmental studies. He has a MFS in community forestry from Yale University, and he has a PhD in social ecology from what was then the School of Forestry and Environmental Studies. Dr. Grove is the lead author for the Baltimore School of Urban Ecology Space, Scale, and Time for the Study of Cities book, which advances a new school of urban ecology for the 21st century. In 2001, he was the recipient of the President's Early Career Award for Scientists and Engineers for his leadership, enthusiasm, and initiative in integrating social and ecological sciences in urban contexts, and always understanding that people matter both individually and collectively. So over to you, Dr. Grove.
Thank you. Just to clarify, Karen, you don't have a question you were going to answer. Okay, we'll just get started. Welcome, everyone. It's my privilege to be moderating this session and to have such wonderful panelists for this session. We have a structure for this period of time, going from 1:15 to 2:45. What we'll do is I will briefly give introductions of each of our panelists. Then we'll go to presentations. We will start with Sarah and then go to Greg and then go to Catherine. Each of them will have 7 minutes to give a presentation. After each of the presentations, we'll have a few minutes for any questions that people may have. Once we're done with all of the presentations, we'll then have another period of time for the moderated questions and answers. We'll have questions coming from the Q&A. We also have some prepared questions, and ideally, we also may have questions among the panelists to further illuminate the conversation. So with that, I would like to get started with the introductions, and I will start with Catherine Nagel. The City Parks Alliance is the only independent nationwide membership organization solely dedicated to urban parks and is based in Washington, D.C. Since joining CPA in 2004, Catherine has created a national advocacy campaign to increase federal funding for urban parks, developed a suite of community capacity building programs to strengthen local park stewardship, designed a training program on public-private partnerships, and established the biennial Greater and Greener International Urban Parks Conference as a premier event for park leaders. She holds a Bachelor of Arts degree from Bucknell University, a master's degree in landscape architecture from the University of Pennsylvania School of Design, and has completed the executive program for nonprofit leaders at Stanford University's Graduate School of Business. Greg Bratman is an assistant professor of nature, health, and recreation, and the director of the Environment and Wellbeing Lab in the School of Environmental and Forest Sciences at the University of Washington. This work takes place at the nexus of psychology, public health, and ecology, and is focused on investigating the ways in which the environment is associated with human well-being. Dr. Bratman is a Doug Walker Endowed Professor at the University of Washington and a JPB Environmental Health Fellow through the Harvard T.H. Chan School of Public Health. And we also have Sarah Sharp Powers, who is the co-founder and executive director of the Natural Areas Conservancy. The NAC is a pioneer in the field of urban conservation, using data and science to develop innovative new ways to manage urban natural areas so that they provide recreation opportunities for diverse users, protect local biodiversity, and provide environmental benefits. Sarah has led the development of a 25-year forest management framework for New York City, a data-driven plan to restore and create public access in 7,000 acres of forested parkland. In 2018, she initiated a new national network with collaborators from 12 cities to advance the field of urban forest management. Sarah has a BA in economics from Binghamton University and a MEM from the Yale School of the Environment. With that, I'd like to turn it over to Catherine to get us started.
Great. Put this up. All right, well, thank you so much. And it's a pleasure to be a part of this conversation. A little bit about City Parks Alliance. We, as you heard, we are, let's see. Hold on one second, just having a little problem here. Just a second. My screen is just frozen. Let me just stop here. See if I can bring this up again. Can you see that?
Not yet.
Yeah, okay, let's try it again.
Okay.
Sorry. All right, can you see that?
Yes.
Okay, sorry about that. So a little bit about City Parks Alliance. We are a broad-based network of public, private, and nonprofit sector organizations, and we're really focusing on the intersection between parks and other urban infrastructure to build equitable and healthy cities. Just get this. There we go. And during the pandemic, urban parks have been the one place where all people could go for so many reasons that relate to mental health, to take a run or walk, for temporary shelter, to continue important family and community rituals, to protest injustice, to mourn loss, and for emotional healing. And the importance to our lives and resilient cities came to light I'd like to share with you a few observations. For years, park advocates have talked about the physical benefits of nature, and of course, researchers have provided ample evidence, but in the past 18 months, we've seen a significant increase in attention to the mental health benefits. And for those of us who live in cities without backyards, there was more stress and anxiety than usual, especially if you are an essential worker, a caregiver, or child struggling with online learning. Access to parks was even more critical for people whose housing situation was cramped or insecure. Parks provided safe places to socialize and feel connected and lowered chances of virus transmission compared to being indoors. But as you'll recall, in the early months of the pandemic, public health guidance recommended avoiding gathering in large groups outside. As a result, many cities closed public playgrounds with high-touch areas like swings and sliding boards just to be extra cautious. And it was difficult. Park leaders grappled with these rules from public health officials, knowing that in many urban areas, the local playground may be the only accessible and safe outdoor recreation space for children. In most cities, though, passive park space remained open, except in DC in some areas, which helps us cope, but created maintenance challenges from overuse. Some parks saw their use double. And across the country, there was an increase in use of rail trails by 60%. Parks were important because 1 in 4 adults in the US suffer from anxiety, depression, or other mental disorders. And I just read that there was a 400% increase in these issues between January 2021 and January 2020 and January 2021. And this is especially important because city dwellers have a 20% higher risk of anxiety disorders compared to people who live in rural areas. And that number goes up to 44% if you live in a neighborhood with little or no green space. But research also shows that time in parks can cut levels of stress and anxiety in half, and just 20 minutes in a park setting can improve a child's concentration compared to the effects of medication. A recent study found that people who walked for 90 minutes in a natural area versus a high traffic urban area showed a decrease in activity in the part of the brain that's associated with depression. But what's interesting is we also saw how quickly park and recreation departments, which have land and buildings and multi-skilled staff, pivoted their operations to strengthen the safety net, serving as civic infrastructure. By offering daycare and classroom space for the children of frontline and essential workers, they distributed food. They helped the unhoused by converting rec centers into temporary shelters or tolerated encampments in parkland. They served as health hubs to provide COVID testing and vaccine distributions. And early in the pandemic, Central Park even hosted a temporary hospital on the Great Lawn. Lastly, these park and rec agencies provided virtual programs like online yoga classes or even live streams of natural areas to help people with their mental well-being. We also saw cities become more park-like. Paved areas and parking lots take up about 30% of urban land, while parks and open space occupy only 15%. And this ratio changed during the pandemic. Parks merged with the public realm as sidewalks and streets were reconfigured, and many parkways were closed to cars, and some cities created slow streets to reduce traffic and increase the space for pedestrian and cyclists. And so this flexible space provided safe outdoor environments close by for people to socialize and exercise, relieving anxiety and depression that came from the isolation we were all feeling. Especially important for those who are, again, in housing situations that might not have been felt safe or were unhealthy. Closed streets also allowed for commercial activities such as outdoor dining that kept restaurants alive and workers employed, and provided space for cultural activities to keep downtown areas active and safe. And lastly, the closed streets allowed some cities to create play streets where the park and rec departments could bring recreational activities right to the neighborhood in those streets. We also saw institutional grounds, for example, around city halls and churches and cemeteries used more as parks as people sought solace in nature wherever they could find it. And so many cities are considering making these changes permanent, and that's good, creating more health-oriented city design. that emphasizes the connections between neighborhoods and streets to parks and other natural areas, just to create that stronger green network. Parks are, of course, places where dialogue, protest, and cultural expression happens, where we exercise our rights of speech and peaceful assembly. And the pandemic coincided with numerous incidents of racial injustice, resulting in massive protests throughout the country, in streets and in parks, which helped us process our collective and individual trauma and grief. The violence associated with some of these events remains memorialized in public realm spaces. For instance, the Black Lives Matter Plaza, which you see here on a stretch of 16th Street in front of the White House, became a temporary park, closed off to cars, and used for protest, celebrations, and performances. And it's now undergoing change as a new hybrid park space that will be a permanent memorial with benches, lighting, signs, trees, and other amenities, while also still serving as part of the transportation grid. And through these movements, we continue the conversation around how historic narratives appear in our public spaces, from the names of parks to the figures we choose to represent in them. Until 2020, there were no statues of women in Central Park. And during the pandemic, we continued to see the removal of monuments to oppressors in parks across the country. How parks are managed can also send strong signals about who belongs or who's excluded. Park leaders began to recognize the role their policies play in creating barriers to use, especially among youth who may be feeling unwelcome in our parks due to everything from signage about loitering to decisions about which facilities, such as basketball courts or tennis courts, to keep open or close. And as a result, there's been a shift toward creating more culturally relevant and inclusive programming in a way that really reflects community identity. Researchers are still unpacking the impact of the pandemic on park use. Of course, we've seen that there's been an increase, but one study revealed that park visits in predominantly white neighborhoods increased an estimated 43% more than park visits in communities of color during the first year of the pandemic. Another study that was just released in North Carolina suggests that those who were already park users in that state, a group that was more likely to be white or higher income, were more likely to use parks during the pandemic. And it may be that those who were fortunate to be able to work from home had more time to take advantage of local parks, or there may be access issues. The routes to parks may not be safe or viable, or the parks themselves may not be well maintained in some neighborhoods. And then there's the issue of pre-existing health conditions such as heart disease, obesity, and diabetes that have been exacerbated during the pandemic. But these results confirm what we already know about park inequities. Across the country, more than 100 million people, or 28% of the population, lack safe and easy access to parks within a half-mile of home. Parks and green space, which filter and cleanse water and air and reduce heat in urban areas, are essential components of our public health system, especially as we face climate change. And we need more of them to maximize all the benefits. We need to advocate for their protection, and we need to fund their maintenance and programming, as well as land acquisition. And the good news is that as Congress moves forward with the infrastructure bills, parks are considered in both the traditional and social packages. So the pandemic has given us the opportunity to make the case for more funding, but we really need to seize this moment before the attention fades, especially at the local level, which provides the bulk of the funding for operations and maintenance. Flexible, inclusive, and accessible nature offers a more holistic way for us to address the human condition, especially in times of crisis. Thank you.
Thank you very much, Catherine. Do we have any questions at the moment for Catherine before we go to our next speaker? Okay, then if not, then why don't we go next to Greg?
Okay, great. That showing up okay? Everyone see my screen?
Yes.
Make sure. Okay, great. Great. Well, thank you for that great talk and for the introduction, Morgan. My name is Gregory Bratman. I'm Assistant Professor of Nature, Health, and Recreation here at the University of Washington. And I'm really grateful to be speaking with you today. So I'd like to start with a land acknowledgement of where I am here at the University of Washington. I acknowledge the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. And I acknowledge our indigenous connections as well as the histories of dispossession and forced removal that have allowed for the growth and survival of this and so many of our institutions. So I'm here to talk to you just a bit about a particular lens on nature and health. And I want to point out that the approach I'll be talking about today is centered around a relationship with nature that doesn't by any means represent all perspectives or cultural relationships with the land. It's certainly more of a medical model approach, so to speak, and its focus is therefore narrow in many respects. And before we even begin to talk about the scientific approach itself, there are some other critical foundational points I'd like to note as well. And the first is access to nature and how inequitable this access is in our society, as was just mentioned in our last talk. And this has multiple root causes, many of them stemming from structural, environmental, and institutional racism. And one way this manifests is through infrastructure, such as streets and highways that are designed to act as barriers and lack of nearby residential green space due to discriminatory redlining and segregation practices that have taken place in our cities and have left behind a built environment with decreased tree canopy coverage, more impervious surfaces, fewer parks, and increased levels of air pollution for low-income communities and communities of color across the United States. And there are social exclusionary barriers as well. These include experiences of racism in blue and green spaces, as we've seen recently with Christian Cooper in Central Park, and many other instances. And there are ways in which natural spaces in the US are racialized. People are made to feel out of place and unwelcome in urban parks through white clientele, a lack of inclusive signage, fears of persecution, and other factors. And as these scholars document, and others, it is critical to address power and privilege in US parks and open space. Now, the impacts of the natural environment on human well-being have been considered in a variety of ways for many hundreds of years, thousands even, whether it be the ways in which nature is thought of as a component of therapeutic landscape design, as a healing power in hospital gardens, horticultural therapy, or of course, these religious and spiritual traditions across the globe that date back millennia. In terms of recent work in environmental psychology and public health, several theories about pathways from nature contact to health have driven research in this field for some time now. And I don't have time to go here into depth in any of them, but I'm happy to answer questions later if they arise. And we can see here, broadly speaking, they range from a focus on cognitive function and attention restoration to reductions in stress, to increases in immune function, physical activity, and this idea of social capital, social cohesion, and pro-social influence of green space and blue space and nature contact. And methods for measuring exposure are quite varied. So some can involve the use of satellite imagery and maps that capture the proximity of residences to green space, or a calculation of total amount of green space around a point as a cumulative opportunity metric. But when we do these calculations, we need to specify what we mean by exposure in each instance. For example, are we talking about visual stimuli or olfactory or auditory experiences? And what are the characteristics of the human nature interaction, as Dr. Peter Kahn points to in his labs on interaction pattern? And to study pathways in controlled settings, researchers are increasingly using technological nature, virtual nature, to study causal mechanisms within a laboratory setting. Now, this allows for tight control of stimuli and things like that, but relevant questions here include whether these virtual reality experiences have the same psychological impacts or even the same pathways as real life experiences of nature. The ways in which nature contact impacts mental health in this field have been studied using a broad range of methodologies, from observational and cross-sectional approaches to natural and controlled experiments. And studies have taken place over a range of duration of exposure. So over the course of minutes to hours to days and even years. And the types of exposures can range from images on a computer, as I just mentioned, or virtual reality, to window views of natural spaces, to being present within them. And they also vary across different types of nature, represented by the different colors of the bubbles here. And each circle here represents the number of studies within these categories as of this review from 2012. Since then, there's been an explosion in this research, but the relative proportions remain about the same. So we can see there are a lot of cross-sectional green space studies, and fewer in some of these other categories of work. Where I work is much more in the presence within natural or urban environments on the scale of minutes to hours. And just to mention a couple of studies we've recently conducted. In this first one, we tested urban and suburban participants before and after 50-minute walks to which they were randomly assigned, so either nature or urban environments. And all were randomly assigned to their condition and tested before and after. So we could sort of attribute the impact of the experience with some degree of certainty to the environmental intervention. And we observed some compelling results when it came to affective or mood responses. So decreased anxiety, decreased negative affect or mood, increased positive affect or mood. And we also assessed an aspect of emotion regulation in these individuals. And this is specifically a maladaptive form of emotion regulation known as rumination. And in simple terms, this involves repetitive thought focused on negative aspects of the self. It's associated with negative mood, and in some cases, it can be associated with the onset of depression for some individuals. And we ask questions such as this: my attention is often focused on aspects of myself I wish I'd stopped thinking about, with validated questionnaires from the psychology literature. We also noted a self-reported decrease in rumination in the nature versus urban group. So in a separate study using 38 different participants, likewise randomly assigned to the same nature versus urban environments, we tested them before and after 90-minute walks. And we observed this decreased self-reported rumination, but we also observed decreased blood perfusion in the subgenual prefrontal cortex for the nature walkers, which is an area of the brain that's associated with, among other things, ruminative thought. So these and other studies are now progressing into us asking, so how do what we could call the active ingredients of the environment influence, in this case, psychological mechanisms? And these are just a few of the relevant ecological features we consider. We also need to think about whether it's the presence of beneficial natural elements or the absence of harmful urban elements, or an intersection and collection of the two that may lead to park benefits for mental health or other kinds of nature contact. And as we begin to understand these pathways, it's important to keep in mind that different kinds of nature impact different people differently, and context matters. And so we need to think about mediators, and by that I mean I'm referring to pathways that can explain a causal relationship between two variables. And by moderators, I'm referring to characteristics of the individuals or the populations that might modify the effects that come from nature contact. So there are many examples of this, but as just one, here's some recent work we've done that shows across 18 countries, people benefit less when feeling social pressure to visit nature. And this goes even more strongly for individuals who are experiencing anxiety and depression disorders. So if we can arrive at these values, how do we most effectively integrate them into planning and other policy and decision-making contexts? And there are many contexts that we can consider. One is nature in schools, so green space, trees, bushes, other natural elements. There's a vast distribution of how much of this nature occurs within and around school grounds, and science is starting to show that this may have an impact on our children's brains and behavior. And another critical example of a context for decision-making, we need to focus on equity. So as we continue to show how nature benefits urbanites psychologically,